We are going to start our teleconference board meeting. It's Thursday, August 21st, 2025 at 1 p.m. I'd like to start with roll call now that the meeting has been called to order. I will ask each board member to state their name, location, address, and if there's anyone from the board or public with them at each location. I'll start with myself. Board Chair Gilda Dominguez. I am at the Glendora location at the Galeras Family Education Center, 427 West Carroll Avenue, Room 1, Glendora, California, 91741. And I do have two board members present with me. Dr. Amy White.
Yes, I am at the board office at 1601 Response Road, Suite 260, Sacramento, California, 95815. I have two other members of the board and multiple board staff and others in the room.
Thank you. Mr. Todd Borges.
Here, also at the board office at Response Road.
Thank you. Dr. Tamara Chambers.
Present. I'm also here at the Galeras Family Education Center here at Carroll Avenue.
Mr. Francis David.
Hi, Francis David. I'm here also at Glendora location.
Dr. Charles Sanders.
And I'm here at the Response Road location.
Thank you. And Ms. Karen Chang.
Here I am at the law office of Scott Wormuth, 17700 Castleton Street, Suite 168, City of Industry, California, 91748. And I do not have anybody here with me.
Thank you. At the Galeras Family Education Center, we do not have anyone from the public present. At the board office on Response Road, do you have any public attendees present?
We have no members of the public.
Okay, thank you. And Ms. Chang, do you have any attendees from the public at the law office of Scott Wormuth there?
I don't have any attendees of the public with me here.
Okay, thank you. Board office, would you like to state who is there from the office staff?
Absolutely. Starting with myself, Sharice Burns, Executive Officer for the Speech and Hearing Board.
Maria Liranzo, Ledge Analyst.
Yuping Lin, Board Counsel.
And DB Miller, Regulatory Counsel.
And that's everybody here.
All right, thank you. I'd like to move to agenda item 2, swearing in new board member and appointment to board committees. So now I'd like to introduce our newly appointed board member, Francis David, and ask him to stand and come towards me and place his hand on the board's law book so we can follow with the oath. Place your hand on the book and repeat after me. I, Francis Albert David, do solemnly swear or affirm.
I, Francis Albert David, do solemnly swear and affirm
that I will support and defend the Constitution of the United States.
that I will support and defend the Constitution of the United States.
And
This is the moderator.
Yes.
Can we ask Mr. David to step closer to the microphone, please?
Thank you. We will continue. And the Constitution of the State of California.
And the Constitution of the State of California.
Against all enemies, foreign and domestic.
Against all enemies, foreign and domestic.
That I will bear true faith and allegiance to the Constitution of the United States.
That I will bear true faith and allegiance to the Constitution of the United States.
And the Constitution of the State of California.
And the Constitution of the State of California.
That I take this obligation freely.
That I take this obligation freely.
Without any mental reservation.
Without any mental reservation.
Or purpose of evasion.
Or purpose of evasion.
And that I will well and faithfully.
That I will well and faithfully.
Discharge the duties upon which I am about to enter.
Discharge the duties in which I was about to enter.
Thank you. Welcome to the board.
Thank you. Thank you, folks.
I would like to ask if there are any comments from the board.
As the executive officer, we just want to welcome you, and we're very glad to have you on the board, David. Francis.
Thank you.
All right, thank you. I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment on the swearing in. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. People will be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires. We're going to take just a few more seconds to see if we have a request for public comment. And Tim, one more slide up. Thank you. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. And as a new board member, I'd like to introduce and welcome Francis also to the Speech Language Pathology Practice Committee. And this will be his first meeting. All right, moving on to the Speech Language Pathology Practice Committee meeting agenda. I'll call roll and establish a quorum. Gilda Dominguez, myself, present. Dr. Tamara Chambers.
Present.
Mr. Francis David.
Present.
Thank you. We do have a quorum. And we are at the location at the Galeras Center, and there are no members of the public present with us. I'd like to move to agenda item 2 for public comment for items not on the agenda. I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment for items not on the agenda. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. We'll move on to agenda item 3, discussion and possible action to amend regulations regarding scope of responsibility, duties, and functions of speech language pathology assistants related to swallow therapy as stated in Title 16, California Code of Regulations, CCR section 1399.170.3. I'd like to ask Ms. Lorenzo to present the agenda item at this time.
Thank you, Ms. Dominguez. On November 30, 2023, the committee began discussion on practice restrictions on SLP or SLPAs regarding the performance of swallow therapy with bolus material. At its December 2024 meeting, the committee discussed restrictions in neighboring states and the scope of practice for both the occupational therapy assistant and physical therapy therapist assistant. The committee directed board staff to provide information on the following information at its last meeting in May. Curriculum related to swallowing and feeding for both board-approved SLPA programs and OTA training programs, the role of OTAs under the supervision of OTs with advanced practice in swallowing assessments, evaluation, or intervention, the setting in which OTAs are performing swallowing feeding therapy, and the registrations of OTs as SLP aides when they're operating under the supervision of SLP for the purpose of fulfilling their 240 hours of experience required to obtain their advanced practice certificate. At this meeting as well, the committee directed board staff to provide information on where OTA work, which we do have a report as attachment A. The committee also directed board staff to draft regulatory that would remove restrictions on SLPAs performing swallow therapy with bolus material, which can be found in attachment B. The changes for the regulations are to remove the restrictions that are currently in the California Code of Regulations 1399.170.3. And we do have some discussion questions for the committee to look at and discuss as we're, work on drafting the text. And that is all I have to report. We do also have other attachments such as OT's laws and regulations, as well as for discussion regarding coursework for an educated SLP graduate application. We've also included ASHA's a technical paper on swallowing disorder graduate curriculums, as well as pediatric speeding and swallowing that can be used for the discussion questions.
Thank you so much for presenting that to us. We'll go ahead and open up our committee discussion. Did you want to go through the discussion questions, or did you want?
I could lead the discussion with the discussion questions. So our first question was that given that OTs are required to complete coursework in addition to supervised experience, and SLPA programs do not include swallowing curriculum, should there be a coursework requirement for SLPAs to perform this therapy, swallow therapy with bolus material? Like I mentioned, we have included for discussion kind of how foreign educated SLP graduate applications are reviewed, specifically that they do have to have coursework with content related to swallowing. And then, let's see, and then reviewing and to give a bit of background of what currently the coursework requirements for SLPs are, we did look at state programs and saw that they are completing at least 15 hours of academic coursework. So that's just one thing we wanted to bring up to ensure that the committee, if that's something the committee wants to reconsider, or to see what other areas licensees are doing, to see if this is something that should be required for SLPAs.
Well, I wanted to mention that I did look at some course sequences for students at a couple of colleges that provide the OTA degree. And one of them listed on their course sequence, there's a course that's listed as Advanced Pediatric Practice for the Occupational Therapy Assistant, the OTA. And it's addressing the focus to be on examining a variety of settings related to pediatric occupational therapy practice and provide OT treatment to pediatric clients in these settings. And that is an advanced pediatric practice course. And then I think that's the main one, but then there are opportunities for fieldwork practice that are being provided for multiple areas. Also, in what you provided for the OTs where they work, a lot of them work in skilled nursing facilities, long-term care, and home health agencies, and Medicare does acknowledge them as clinicians, but for speech language pathology assistants, they are not. So that adult population would be something that wouldn't be feasible or actually practical for the SLPAs to provide this area of therapy. But I would like to talk to the committee about what the thoughts were for at least the pediatric population, since the OTAs are providing services for that age group. Not the infants, not the neonates, but looking at the pediatric population when it comes to swallowing. But there is that course content that I did come across that I thought was interesting, and maybe it's something that could be mirrored for those who are applicable to do that for as SLPAs.
So for SLPAs to be able to do swallowing without.
I'm
sorry.
Yes.
Swallowing therapy.
Remember, so SLPAs do everything under the supervision of a speech language
Absolutely.
pathologist, and they don't change the treatment plan, and they're not going off on diagnosing and changing the treatment plan, right? But following a treatment plan. ASHA, I did also see under their scope of practice for the SLPA, it's on the website that's dated 1997 to 2025. The reference for this material is American Speech Language Hearing Association 2022, Speech Language Pathology Assistant Scope of Practice, brackets Scope of Practice, available from www.asha.org/policy. And they talked about under service delivery, the SLPA should engage in the following activities when performing necessary tasks related to speech language service provision. And several bullet points down, they mentioned right after developing low-tech AAC materials for students, patients, and clients. The next bullet point says demonstrating strategies included in the feeding and swallowing plan developed by the SLP and share information with students, patients, clients, families, staff, and caregivers. The next bullet point states assisting students, patients, and clients with feeding and swallowing skills developed and directed by the SLP when consuming food textures and liquid consistencies. I wanted to present that to the committee today for some additional input and discussion. So I guess back to your question one, I'd like to reach out to the committee and see what you think.
Well, so I have SLPAs that they're practice, and I don't think that giving them a swallowing type of therapy would be the best thing, unless they would have advanced training on them. I don't feel comfortable in having my own personal SLPAs do swallowing therapy for pediatrics. But that's just my opinion.
Unless they had advanced practice.
Unless they had advanced practice and several classes. Because looking at because I've looked at several SLPA courses also. I looked at several SLPA programs because we were helping develop probably one also, hopefully soon in one of the colleges that close by. There is no swallowing, which is a very dangerous way if you don't know what you were doing. So I personally do not feel comfortable in having my SLPAs do that at this time. That was just my.
Oh, I think too. Since Mr. David wasn't with us in the last committee, I'll just give him an update of what was discussed last time. So the committee discussed requiring 240 supervised experience in swallow therapy before they can perform any treatment.
230
swallow therapy on their own under direct supervision, obviously. But we didn't include that information in the text, but that's one of the requirements that would be required for SLPAs to perform that, is that they would have to have supervised experience in performing.
So the supervised experience does not include any formal classes, do they?
That is correct. And so that's why we were asking, the first question is about coursework, if that's something that should also be included.
Thank you.
So when you look at advanced practice for the occupational therapist, they also require a certain amount of coursework. I believe it's like 45 academic hour. So they're requiring education and experience. So the question mark is if we're going to try to allow SLPAs to do this advanced level of practice here that's currently restricted, but that's because it's not currently in their education or fieldwork experience. what would we want to require in order for that to make them competent to do so? And so we didn't get to it last time, but talking about the educational components, now that we've reviewed a couple SLIPA programs and even bachelor's level communication science disorder programs, there's not much in the swallowing realm in any of those. So it might need to be that you need to take 2 semester long courses or 1 semester long course in swallowing and dysphagia in order to qualify to do your 240 hours. And while that may seem daunting right now, of course, there's always different ways, like currently the speech language pathologists, when they're doing the fees study, right? So they go and take trainings that are multi-day training, and then they also do the supervised experience there as well. So there's different models for people to accrue that education and experience, but we might want to talk about how many hours of education, how must it look? Does it have to be at a university, or could it be 45 hours of coursework? Those kind of things to look at, because right now they're not getting that education. So in general, to protect consumers, we want to make sure that you've had the education and experience to competently do something. And we wouldn't want to add that unless there was the education and experience to do so.
Yeah, for example, with that advanced pediatric practice for the CODAs, that class is 54 hours for 3 units. Now, it doesn't say if it's specifically for swallowing. However, they do have this course for advanced practice for a CODA. But how feasible would that be for our programs in California to add that? Or
I can give you the answer from one program. From the one program that I asked, number one, they do not have room in their curriculum to add this. And number two, they would not feel comfortable in teaching it either. So that level of lack of time and space and lack of comfort could very well be a problem of it becoming part of every SLIPA program,
right,
which is why this might need to be an extra outside of the program coursework that they need to attain outside of their curriculum, just the same way that speech RPEs go out and get training to do the fees study, even though they've done some swallowing labs, right? They've done the 2 courses in swallowing and dysphagia at their master's program, but they then additionally go get training just about the fees procedure and using the flexible endoscope, right? And then they do the supervised passages. So I think the idea being that we're trying to figure out a way to mirror what the fees does, because the only restriction on swallow therapy with bolus material is our own regulation. But if we're going to remove that regulation, what minimum standard do we want to require education and experience wise?
And just to clarify, the expectation currently, if you're getting to go through the fees coursework, that is 1 semester, or that is 1 course, or how many hours?
Currently, we don't have anything about coursework in there because most SLPs will have 1 in swallowing and anatomy. Where's it at? I'm sorry, anatomy and physiology of swallowing, and then they'll have a separate course on swallowing dysphagia that also includes a lab. The extra training is usually sought after on their own, and it's often part of a multi-day course that has training and the first few passages with an otolaryngologist. So they tend to combine that, even though we don't require that extra course on it. So.
Yeah, providers will, when there's opportunities like this to help educate the community, train community, they will take on the role of providing trainings in like a classroom setting to get more people certified. And so we do expect something similar to happen to swallow therapy for SLIPAs. And so it's just establishing the minimum requirement for SLIPAs to be able to perform this that will keep the public safe, especially since currently, as Sheree said, the schools don't have the capacity and nor do they have the space in the curriculum to include that. So it kind of falls on the responsibility of the board to kind of create those barriers for performing this procedure.
And all of the training programs for the slip of, or the SLP fees process, that's made outside of the board. We've never directed any of that. That's all been done by the professional community in order to ensure everybody's confident.
Mhm.
And each location and each opportunity might be different. I mean, some might do it at their own hospital and others are taking a course and they're flying in from all over in order to take it. We're not as specific, but considering that FLIPAs have a lower level of education and none of it includes swallowing and dysphagia, I think we might have to say a certain number of hours of coursework and if there's any minimal requirements to that.
So coursework means like a CEU course, right?
That's what we're envisioning.
Yeah.
Either it could be CEU or taught at a university where the university is offering it. Same thing where you can go to some of the state universities and take a course through their continuing education program.
Mhm.
There's opportunities. If the board were to allow it, there would be opportunities to create those kind of systems and courses, along with just taking CEUs that would also complete that task.
When you talk about classes that they're gonna take, do we have an idea of what classes we would want them to take? What are the prerequisite classes? Like I'm thinking at least anatomy, physiology.
Yeah, so those are currently the two course content we look for in programs for foreign educated. When we're doing for foreign educated, we look course by course. And so those tend to be either as two different courses or one courses at a master's program, depending how they're set up. So we're looking for something probably recommending something similar for the SLPAs, that at least they have a course in a course or two in those two topics.
And most semester courses would be 15 hours, where each unit is 15 hours. So one semester long course would be 45 hours. So it's still a pretty high hurdle, and that they need to get enough continuing education to show that they have really grasped the anatomy and physiology of swallowing and dysphagia. So I think that's where we're thinking it needs to be an advanced level of training and education here.
So would it be feasible to suggest like, so it's a minimum number of CEU hours that we would need to establish, whether it be 45 or 80 or something, right? We need to look at a minimum standard regarding continuing education. And then that would be in addition to the supervised experience?
Yes.
Yes, yeah. Especially as as we've been talking, the programs don't have anything on swallowing, and they currently aren't doing it or shouldn't be doing it. So,
and their field work wouldn't have included it because it's currently prohibited. So there's no way for them to have gotten any experience in it yet either.
Right.
Is there something that we can mirror this, rather than just like randomly picking out a number? Is there like an audiology equivalent or something where we've already kind of established what we thought that looked like, that maybe has worked well to try and keep consistent across both of the fields?
Not really. I think your closest model is actually the advanced practice in swallowing for occupational therapists. And that's where they require coursework and experience. But I would tell you, having sat in on their practice committee meeting, they are looking at reducing the hours from 240 to far less, although that is up for their own discussion. So we would want to look at how long does feeding therapy with bolus material last, and how many of those times should be required, right? If every feeding therapy with bolus material is about an hour between, all of the documentation and the therapy, how many of those times would we want? For speech pathologists in the fees program, we say 25 passages because it's a procedure they're doing with an instrument, right?
Yes.
As where this might be different. How many hours and how many times should they be doing feeding therapy with bolus in a supervised capacity in order for that SLP to be willing to sign off on something to say, yes, they're competent? So that might be the better question. And then I don't know, since nobody's currently doing it, it's a little bit difficult to say, but we should kind of be thinking in those terms. It could be, it's similar to the number of passages, right? If it's 25 passages, that's 25 hours or 50 hours, however long that is. What are we doing with speech language pathology assistants? Should that be a certain number of feeding therapies? And how does that equate to a number of hours?
Shouldn't go anything under 45.
Yeah, my thing is because of the problem solving that you need to do during a feeding therapy. There are the clinical decisions you have to make during feeding therapy, especially pediatrics. I would personally like a higher number of hours. And speaking of that, I was just wondering, what would be the feasibility of having a certification course for feeding for advanced practice for SLPAs for feeding? Is that a possibility?
So it would be, I mean, that's very common. I get inquiries about SLPAs completing certification. That would be one way they would complete the education and supervised experience.
Okay.
As we mentioned, that's what's currently happening with fees, is that they're getting some education and doing their supervised, at a 2-week, 3-week course. So we do see something similar to SLPAs happening. I don't know if it's necessary to specify that in regulations. That way, if like a hospital, they want to do their own program, giving them the flexibility of creating their own program if they don't want to go through the option of outsourcing it to a certification program.
And that's where, saying it's 45 contact hours, which is similar to what a CEU course is, it needs to be structured. You could specify the parameters, right? And that's where regulations can be specific on the parameters, but not so restrictive to say it has to be a university course. It has to be a community college course. It can be this many hours and it's a structured curriculum and it covers blank, blank, and blank, right? It's got to cover all of these elements. And that's where sometimes the regulation can help specify those things, but not go so far as to restrict it to only certain settings.
Well, again, going back to that advanced pediatric practice for the CODA, that class is 54 hours for 3 units. Now, again, I don't know what is entailed in the agenda or the books but it's 54 hours of classwork. And then this 240 that we're also going to be discussing, does that stay at 240? 240 hours, how feasible is that
240 hours
in this for
we don't get
feeding?
at the clinics that I'm at, we don't get a lot of feeding. The OTs are doing the potential of feeding.
Okay, so so to that point, so how much time are they spending with a child, with a client?
Useful authorization will give you about 60 minutes per session.
60 minutes per session, okay.
That's the authorization that would be given by most insurances right now.
I can't hear you.
Oh, yeah, most insurances right now would give about 60 minutes of authorization per session.
So 60 minutes.
So before we move on to question 2 regarding the numbers of hours, so it sounds like that the committee would like to consider requiring coursework and possibly it being a total of 45 hours.
Now, 54 minimum? 50.
Is that the course for?
That's 3 units.
That's 3 units, right?
That's 3 units.
Currently, our regulations specify 1 academic semester unit is equal to 15 hours. So if it was a 3-unit semester long course, it'd be 45.
45 then, okay.
That's what if we're trying to have consistency with our regulations.
Okay, sure, yes, 3 units.
And then we're looking at the course content to include at least anatomy, a physiology of swallowing, and swallowing dysphagia.
Yes.
Now, in regards to provider, it could come from a board-approved provider, which includes universities, professional organizations like ASHA. What else do we have? Board-approved providers.
The question mark being that if we say only board-approved CPD providers, that does not include your hospital unless your hospital has applied for a PDP.
Mm.
So this is where we'd want to be specific. Are we as concerned about who's providing it or what's in the content? So that would be helpful for the committee to talk about. If Gilda, you envision that maybe skilled nursing facilities or hospitals want to run these courses. If they're not a PDP already, licensed by the board or ASHA approved, then they're going to have difficulty there unless it's a university course.
Yeah, I don't see them doing this in those areas until government payers change who they feel is a skilled clinician. So it does appear that this would be more on the pediatric side, at least right now.
So then to ensure the quality of the program, we want to go with the fact that the board or ASHA or a university has approved the content rather than us saying, as long as it does this, then we'll take it.
Yeah. I think for safety, for the consumers, I think having it more regulated would be better, especially that since they don't have the coursework in the school.
Agreed.
A fixed curriculum, I think, would be beneficial for this one. Like a standard curriculum wherever it's
Can you
being.
speak up, David? Sorry.
Oh, I was talking about a standard curriculum wherever, whichever provider is going to provide this certification.
Yeah, so usually a board approved providers, we have requirements to how courses and who can instruct. So it will provide a higher quality of courses, outlines and things like that. If the course are from a CPD provider.
Yes. Okay.
Is that going to be too challenging, or is that still feasible? That would be ideal.
I think it would be feasible. I mean, ASHA, I've seen online courses. We mentioned universities can probably open up their continuing education offices to offer like a course on it. Yeah.
And then approved providers, that just means you're approved by the board. And so the board is verifying that everybody's CV says that they're qualified to teach these courses. And that they're regulated by the board. So at least if the university is handling it, the board is approving the provider, or ASHA is approving the provider and their content, then that's at least a level of accountability that these courses would need to meet.
Yeah, I think that's safest.
I would just like to bring up also the supervision for this one. The supervisors for this one should also be trained with dysphagia. Not all SLPs are trained with dysphagia. Because if you're in a pediatric practice, not a lot of these supervisors have swallowing experience. So,
okay, I see what you mean. Yeah, because I know, I guess we'll move on to question 2 regarding the fieldwork experience. Yeah, I don't think we weren't looking at specifying that the licensed SLP has to be engaged in this part of the practice, which we could do. That's how the fee language is written, that in order to supervise someone else, they need to be competent and experienced in that area of practice. So that is something we could specify in the regulations.
Thank you. Thank you very much.
And you're asking if 240 hours is excessive?
It was a question because I was sitting at the occupational therapy practice committee, and they were concerned that 240 hours was excessive for their occupational therapists. And the consideration was more about how many of these therapies should they be providing. So if each swallow therapy with bolus material is 1 hour, we're telling them they need to perform 240 of these in order to be competent. And is that what we're looking at? Or is there a different number? Right now, field work is 100 hours when it's SLPAs. That's for their general field work. Right now, 240 hours comes from the baseline for the occupational therapist to get into advanced practice, which they, as the occupational therapists, are looking at lowering. So again, we just want to put it out there. How many times do we think they need to be doing this in order to become competent or have minimal competency?
And this is them just following a plan of care, not making any modifications, not assessing. It's more of making sure that the client is safe. Again, like what Ash has stated, following the plan of care for safety. Yeah. Right. So they're not changing anything.
That's correct. They would be following the treatment plan of the SOP, and it would be performing the treatment therapy. They're not diagnosing or doing anything like that. We're not too familiar with swallow therapy looks like, and how and the different cases and that kind. We defer to you. So
essentially, how frequently could they even get these hours? And therefore, would 240 hours be like doing it for a year under supervision, or is it doing it for 6 months under supervision? What would it look like in a typical practice if they were allowed to do so, instead of just helping you guys prep this material, right? So that's kind of the consideration here, is how long is long enough for them to learn and gain basic competency?
And how many of the patients that the OT CODAs are seeing that speech pathologists could see? Right, versus just authorizing OT, the OT discipline. What if they also they were able to authorize the SLP discipline to provide this type of therapy?
I mean, it's almost like how many different patient encounters
Yeah,
do you
look at
feel
that
like
guy.
they need to see? And I think that you have to be able to see different kinds of patients
Absolutely.
and manage different emergency situations and responses. So I do think that the number is going to have to be robust,
Yeah.
not overwhelming.
I'm even thinking of
Another 100.
Yeah, I'm even thinking of what kind of patients they should see, because having somebody with the oral face problem versus a pharyngeal face problem is also very different. So
Well, that would be up to the speech language pathologist
right.
to assign a certain patient, right, to
Yeah,
to the SLPA. And we also have an exclusion of certain patients, right, with like excessive movement or, right, I think we listed a few things in there. They're medically fragile, like that's not a patient. that
comorbid
we'd say,
conditions as well.
yeah, they're severe.
How do we feel about 100?
Something like doubling that, yeah. They do the 100 and then you add another 100.
So
200,
200 hours.
200 hours.
Of
Because we were at
Wait.
240.
Well, 100 on top of their 100. So you're saying 100 instead of the 240. That's what you're saying?
600 instead of
Yeah,
240.
yeah. So they do the 100 hours of field work for licensure, and then you're saying another 100 for
Well,
yeah.
That's a lot.
swallow.
These hours would be separate and after their
Right.
coursework. So
Yes.
So
Yeah.
that is postgraduate, post certification,
Post licensure, right?
post licensure.
I think so. Yes, I agree.
What will count as those hours? It's the question. Would an observation count as an hour for that one, or is it direct therapy, or is it direct supervised therapy? Or if I
that's something we can specify, Francis, that it has to be direct patient care hours supervised by the SLP.
I agree. Direct.
direct.
Are they gonna have time to get all these hours in their coursework, like through graduate school and then afterwards? Is that reasonable?
Well, the 100 hours is after.
Yeah,
Right.
The first 100 during
They do
schooling.
it.
They do it.
They do it.
Okay.
Because they do the 100. They do the 100 hours now, right? For
They
license.
currently do that under their SLPA program, whether that's part of an associate SLPA program or it's a post bachelor's CSD program where they've completed their bachelor's in communication science disorder or speech pathology, and they're taking coursework through usually the university's continuing education program that pertains to SLPAs, including the fieldwork course, and the fieldwork course is the 100 hours. So usually you're seeing a bachelor's degree plus 2 courses and a fieldwork. And that's if you're not an associate's degree program holder. And remember, those 100 hours are just their field work, and none of that's going to be on swallowing because they have no education or training in that. So that
Right.
100 hours is really just to get their license, and it's basic speech therapy. So did I hear 200 hours was the recommendation, or was it just stick with 240 then?
You said 100. 100.
Okay.
100 posts, right?
100 post licensure. Yes.
Okay. So mirror the original
Correct.
50 hours.
Direct. Yes.
And we're also looking at it to be supervised by a licensed SLP who's working in swallowing dysphagia.
Yes.
And that in our last discussion, we talked about that it has to be direct supervision.
Yes.
And it sounds like we want to specify that the SLPA is performing direct client care of the swallowing therapy.
Yes.
Okay.
And there needs to be a tracking mechanism of that. And I guess that moves to 3. Right. Yeah.
Okay, yeah, we mentioned about a written verification stating that they are competent and has performed the supervised supervision. Our question was if generally we have them keep the copy of that and provide the board upon request. And so we want to know if they need to have, if the document needs to be original or a copy.
What are you requiring for fees in the office?
We require that they have a written verification stating that they're competent to perform the procedures and they've completed their hours, and that they keep the document on file and readily available for board inspection.
I think we should mirror that. They're agreeing. You guys agree?
Yes.
Okay.
Consistency.
Really quick, do we want to clarify that the supervision the SLPA is getting during these direct content hours is immediate versus direct? So remember, for SLPA's direct is that they're on site versus immediate, which means they're in the room and physically present.
Are we talking about the first 100 hours?
No, that was the big discussion last time. That was my apologies on the confusion.
Okay. Make sure it's immediate.
Yes,
Immediate.
it's immediate.
Immediate in the room, direct somewhere in the building.
Yes.
Right.
For the first for this one?
Yes. For the swallowing.
Yeah, you want them in the room for those 100 hours.
I would personally prefer a direct supervision.
Direct is on site. Immediate is in the room.
Immediate, actually.
Immediate. Okay.
Yeah, we use different language.
I know.
I'm learning the terminology of it.
Immediate.
All right. Yes, that is noted. So it doesn't sound like we want to get into too much detail of what the written verification should look like. Just that they have one, and that it's on file
and verifiable if the board requests it.
Yes.
Okay.
Yes, including, yes. So I have yes for all this. Yes, does it require a written verification of competency? That requires the SLP signature and license number. I, what are your thoughts? I think so.
Yes.
Yeah, going back to that question though that he brought up about should it be different, should it be oral, should it be pharyngeal, like all of that. Do you want to specify or just have some of those hours specified in any way?
What do you think, Gilda, on that one? I feel more. I'm just a personal. I feel more comfortable if they're just dealing with the oral rather than the pharyngeal part. The pharyngeal is straight down there away. If it's more of just a mastication issue, if it's more of just a propulsion issue.
It all comes to those together, though.
Yeah, that's true, right? And that's true. A lot of them would be comorbid anyway.
Mm-hmm. It could be.
Or not specify at all. Okay.
I would tell you in some of our areas, we do specify the requirements for the 300 clinical hours. I believe in one of them, it talks about in a variety of age ranges. You could also say that the experience is in a variety of oral, pharyngeal, and et cetera, et cetera. So that the experience includes a variety of experiences in blank, blank, and blank.
Yes, because we are excluding again those complex cases, altered airway. I mean, we're not going to give them trach patients.
Yeah. Although we have to consider also like the swallowing physiology and anatomy changes as they age.
I think I'm not sure if we're going to be able to have
Yes,
the adults
specified,
not
yeah.
yet because
Even like a
Medicare,
12-year-old.
Oh, yeah, you're talking about that.
We'll have a
Okay.
different swallow
Yeah,
setting than a 3-year-old.
right. So yeah, you can consider like that the ages, keep the age ranges and let's see oral phase, official phase. How we can word the oral pharyngeal aspect of it. Cross diagnoses?
Well, your evaluation should be done by an SLP anyway, so.
Right. But there was a mention of oral versus pharyngeal, but that's going to be intertwined. I mean, that
Or ages or any kind of specifications.
ages or deficits or
Pathologies.
yeah.
Just a reminder to speak up nice and loud and clearly in your room.
We could, we'll probably have to wordsmith it with our reg council. We'll look at what language is, when I'm doing, drafting these language, I am looking at what language you're using. I think we could incorporate the different parts, which is the oral pharyngeal. We'll find a way to incorporate it in a language to also cover different age group.
Okay.
So that they get an experience in a variety of age ranges and a variety of speech swallow therapies, including oral, pharyngeal, etc.
Yeah.
Okay. Yes.
Thank you.
Thank you.
Thank you. That sounds good.
So it looks like we're ready to move on to question 4. Any other questions or comments on 3?
Oh, the one
You
question.
said the license in California. My thoughts would be yes.
Okay. The last one, California license.
So that it should be a California licensed SLP who's providing the training, not just any SLP.
Yes, they're saying that. Yeah.
Okay.
I think so.
Method of approval. I think we already talked about 4. But okay.
Yeah, I think the question was method of approval. I think when it comes to most practice is that they're documented as part of the medical history and record of the patient. Is that correct?
Can you repeat the question? I'm sorry.
So we've had questions before on, what kind of orders do they need to receive? Does it need to be written orders, verbal orders and then this for the SLPAs would be verbal approval, written approval, because the speech pathologist, should they be approving that this procedure be done on a patient every single time? And should that approval to do this therapy, should it be verbal or should it be written? And if it's written, does it need to be in the patient's record? That kind of information.
I would personally recommend written order, so we have documentation. Jill Gilda or Dr. Hibbers.
Okay.
Do the quotas
I
fit
think
that?
if that's a standard, I think we should keep it to the standard.
Which is the standard current?
When a coda is doing the therapy, is there a note or an order that's required? Are you familiar?
No, there's not much in their laws and regulations regarding that level of details when it comes to practice, scope of practice.
So how does this look like? Is this in the order that's coming from the provider, or is this documented by the SLP in the record that they have approved the the SLPA to provide the swallowing with the therapy with bolus material?
The latter, yeah, the SLP being the SLPA.
Okay. Yes, written.
Okay.
And I could see them accomplishing this through a chart, right?
Yes.
Where the chart says, yes, I signed off on approval. This is the date it occurred.
Yes.
There, I supervised it, signed off of it.
Yes.
Not that we need to specify that, but that's how somebody could accomplish it.
Okay.
So the next question is, we were looking at sections where to put it, since it is going to be new requirements. We need to identify the best location in the regulations to put it. We were looking at section 1399.170.1, which specifies the responsibility, duties, and functions of a SLPA. Currently, it states that it cross-references the statutes, their duties and functions listed there. So that's one location. That we identified it as being suitable to specify the requirements.
So essentially, do we want to incorporate them into other sections that are about responsibilities and duties of a SLPA and supervision of a SLPA? Or does it need to be its own separate section?
Oh.
Either way is perfectly fine, but we already have 2 sections that talk about these. They could be incorporated into as their own subdivisions, if that's the direction the committee would like staff to take in drafting this.
Is there a format? Again, I know there's that specific section regarding fees. Where is that inserted? Well, is there a comparable location in the regs where this
No,
is inserted, where fees is inserted when you're talking about that?
fees is not in the regulation, it's solely in the statute. So we don't specify anything additional to the statute because it's pretty clear. Not that you couldn't clarify it, but regulations are only needed to clarify and implement the statute, and the statute currently is mostly self-implementing.
Okay.
So that's where we kind of need to go. Is it in a regulation? Does it need to be its own separate special regulation about swallowing therapy? Or can it just be integrated into SLPAs as it currently exists, but to say that in order to do this, you have to do ... And in order to supervise this, we need to ensure ... And
I like option 2.
I do too.
What? Option 2.
which was put it in the current regulation.
Yes.
Got it.
So yeah, if we were incorporating into the regulations, we're looking at adding it into 1399.170.1, and as well as making a cross-reference to it in 1399.170.2 regarding the type of supervision, so that supervisors know when they're looking at the different levels of supervisions and what SLPAs can do, that there is specific supervisions.
At this point, though, with the additional clarification of the committee, we would not just add a cross-reference, but we would specify that it has to be a California licensed SLP, that it
Yes.
also has to be immediate level of supervision.
Mhm.
So we could specify those things in the supervision part as well.
Right, and the SLP has to have experience in,
Yep, competency and then
yeah. And then under 1399.170.3, under the activities, duties, and functions outside, so H, that would need to be looked at as well.
Yeah, so I think in the text we're just removing that last piece of the sentence at H.
Yep, okay, yes.
because that regulation is only about what's outside the scope of a SLPA.
Right, right, then we would just.
And the other sections would say it can be inside of your scope if you do these things.
Yes, okay.
I think we can move on to number 6 then.
And then the final question was, because there was mentioned a lot about children, we wanted to get some more information and feedback about feeding and swallowing in schools, if that's some, special considerations need to be made in that school and that setting, if there needs to be different requirements. Yeah, we just wanted to hear back from the committee about that.
So essentially the question being, when we started talking about supervision of SLPAs or RPEs, by SLPs, we at first had this idea that there should be 2 years of experience. And then we had a comment, which the board took and revised our regulations to talk about hours. Because in school settings, obviously you don't work 2 full years, you work 2 school years, which are however many hours. And so the question here, I guess, is also, we're in hours, so I don't know that that's really a necessity since we're talking about 100 hours. The question might then just be, is 100 hours in a school setting even possible? Is there much of this kind of therapy in a school? Or is this largely going to be outside of schools and in pediatric clinics?
Okay, based on the ed code, feeding therapy is really not considered a DIS or a designated service. So most schools do not do feeding therapy at all.
Okay.
So feeding disorders are usually referred to outside clinics. The only part that a lot of SLPs and OTs work for in the schools is more of the fine motor to trying to eat, more of eating as a function rather than as a physiology. So direct swallowing therapy is really not done in the school setting.
Okay, that's good to know. Thank you.
After our last experience, we always want to check in if something is different about school settings that we need to keep in mind. So great. So I think what we can do is take all of your input and then come back to a future meeting to put them into all the code sections you would like, all of the different requirements, including the 100 hours of immediately supervised swallow therapy with a variety of age ranges and oral and pharyngeal disorders, and that they have written orders for approval. And then everything could be incorporated into those sections, and then we could bring it back for the committee.
Okay, that sounds good.
It will also include what we discussed last time regarding contraindications, settings, and supervision, level of supervision after they've completed their experience in education.
Okay, thank you. Okay, that's it for agenda item 3.
We'll have to go to public.
Well, for our conversation, I think that's it. Okay. I'd like to ask the moderator to open for public. Oh, I'm sorry. Let me back up. We do not have any members of the public present with us. So I'd like to ask the moderator to open public comment on WebEx.
WebEx is open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. And our first request is coming from Nicole Wilson Friend. Hold on just a second. We're going to send you a request to unmute your microphone. You'll be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires.
Nicole, before you go ahead and start, can I just go ahead and say that the Sacramento location has no members of the public? And if our member Karen can also specify whether she has members of the public?
Yes, this is Karen, and there are no members of the public present.
Thank you.
Okay, my turn.
Absolutely.
Hi, this is Nicole Wilson Friend. I'm an SLPA in California. I've been an SLPA for more than 20 years. I'm also the SLPA director for CASHA, and I was on the ASHA ad hoc committee to revise the scope of practice for SLPAs as well. So I am intimately familiar with all of this information and scope that you are speaking of right now. I really appreciate this conversation because SLPAs are absolutely chomping at the bit to have higher certifications and more education in this profession because many of us are lifelong SLPAs. We are not going into master's programs for SLP. So I would really like to beseech you when you're having these conversations to include SLPAs that are doing this work already in hospitals and in medical facilities because we do have SLPAs that are providing this type of service under the supervision of their SLPs who have determined that they are skilled to provide these services as you know as the supervision paperwork requires, and just to have that conversation with actual SLPAs and the SLPs that are working with them. Thank you.
Thank you. And that was our only request for public comment. I take it back. We have Benjamin Reese. Bear with us just a moment. We're going to send you a request for public comment.
Hello, can you hear me?
Yes, go ahead, please.
All right, thank you. I'd just like to echo what Nicole Wilson Friend said, and also mention that when there was a discussion about the training for this particular certification, I didn't hear it mentioned that perhaps the approved community college programs might be a venue for that. I represent San Joaquin Delta College, and I'm interested in this conversation, and if this becomes a possibility, I absolutely would like to offer this through our program. And so I hope that the approved community colleges might be considered as a venue for this. And then lastly, I'd just like to second what Nicole said about talking to hospital-based SLPAs and SLP supervisors. Nicole and I presented at a conference on a panel, and she has those contacts. She had a couple of different SLPAs practicing in medical settings, and I think they would be good resources for this conversation. So thank you very much.
Thank you. And looking around, we're going to say that was our last request for public comment.
All right. Thank you for closing the public comment at this time. Moving on to agenda item 4, discussion and possible action to amend regulations regarding general application requirements and speech language pathology aid and audiology aid requirements and scope of activities, duties, and functions as stated in Title 16, CCR sections 1399.151.2, 1399.151.3, 1399.151.4, 1399.154 through 1399.154.12, and 1399.157. So I'd like to ask Ms. Lorenzo to present this agenda item.
Thank you, Ms. Dominguez. Since November 2023, the committee has been reviewing proposed regulatory language to make changes to the SLP 8's regulatory requirements. At the last meeting, the committee discussed a lot about the level of supervisions and the language that should be used. We do have a summary changes, like with all regulations, there's a lot of wordsmithing that gets done. And so we wanted the committee to take a look at the language we were able to produce based on the discussion and kind of the role, our understanding of the role of an SLP aid. If you look at page 8 of 18 of the text, we have defined immediate supervision, requiring the supervisors to provide immediate supervision while the aide is assisting during evaluations of or treatments of patients, and direct supervision while the aide is assisting when the patients are not undergoing evaluations or receiving treatment, or when the patients are not present. Immediate supervision is to mean that the supervisor is physically present with the aide, whereas direct supervision means that they're on site. We came up with this language because we were looking at the different tasks that the aides were performing based on the applications. And so this is probably the best language to where we expect supervisors to be when aides are doing certain tasks. But we are open for discussion. So that was probably one of the major, or the wordsmithing we had to do when it comes to the definition of supervision. We also did some cleanups in other parts. Actually, if we go back to page 6 and 18, we will be requiring in the application that supervisors specify the level of supervision for each of the duty stay list in the application. And so that's why we have definitions for them to use. Another thing we added was on page 9 of 18, specifying that they shouldn't be performing services that require a separate license, specifically the SIPLA license under the Business and Professions Code 2538.1. And then some cleanups in other parts, making sure that it's clear that a SLIPA isn't providing direct treatment to clients, really just cleaning up the language so that's clear, like the role of an SLP aid compared to a SLIPA. But let's see, did we have a question? I think no discussion question. Language is there for your review, and we do have suggested motion language if you do find these to be appropriate.
Thank you, Ms. Lorenzo. I'd like to open up committee discussion. So are we okay with the changes that have been made?
Yes.
Okay.
I can make a motion.
Okay, I'd like to ask for a motion, and there is suggested motion language.
Move to recommend the regulatory text for Title 16, CCR Sections 1399.151.2, 1399.151.3, 1399.151.4, 1399.154 through 1399.154.12, and 1399.157 to the board to initiate the rulemaking process as noticed and direct board staff to prepare the regulatory text for board review and approval.
May I get a second?
Second.
All right. We're open up for public comment. We do not have anyone from the public present with us here at the Sacramento location. Do you have any members of the public present for public comment?
The Sacramento location does not have any members of the public.
Thank you. Does the City of Industry location have any members of the public present for public comment?
The City of Industry location does not have anybody present for public comment.
All right, thank you. I'd like to now ask the moderator to open public comment on WebEx at this time.
All right, WebEx is open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. As a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. Thank you. I'd now like to ask Ms. Burns to conduct the roll call vote.
Apologies, had to get to the unmute button.
That's okay.
Ms. Dominguez,
Aye.
Dr. Chambers,
Aye.
Mr. David,
Aye.
and the motion passed.
All right, thank you. I'd like to propose a brief break, if that's okay, for 5 minutes, 10 minutes. How does the office staff feel?
That would be great.
Okay, we'll do 5-minute break. We'll return at 2:22. Thank you. All right, thank you. Reconvening our speech language pathology practice committee meeting agenda. I'd like to confirm before being recorded.
This is the moderator. We are being recorded.
All right, thank you. Thank you. Moving on to agenda item 5. Well, let me confirm. We are all here. Myself, Dr. Chambers, and Mr. David are here.
The response road location has Mr. Borges, Dr. White, and Dr. Sanders.
Thank you. And the City of Industry location? I have no response. So, and we do not have any members of the public present. Does the Sacramento office?
We do not have any members at the response road location.
Okay, in the City of Industry location, Ms. Chang?
This is Karen from the City of Industry location. We do not have any members of the public present.
All right, okay, thank you. Now moving on to agenda item 5, discussion and possible action to recommend to the full board to initiate a rulemaking to amend requirements for continuing professional development for speech language pathology assistants as stated in Business and Professions Code BCP 2538.1 and Title 16 CCR sections 1399.170.14 and 1399.170.15. I'd like to ask Ms. Burns to present this agenda item.
Absolutely. So as part of the continuing education audits that the board is now performing on an ongoing basis, we found that we have to educate SLPAs quite a bit on what are approved providers, what is their requirements, and their requirements are actually statutorily set and then mirrored in regulations. So this is actually a twofold item where we are hoping and had talked in the May meeting about changing what kind of continuing professional development SLPAs can use towards renewal requirements. And part of that is that currently the legislation states state and regional conferences, workshops, formal in-service presentations, independent study programs, or any combination of these. What it doesn't say is taking a CE course through any board approved or statutorily approved providers, which is more available than some of the other methods currently on there. Now, the other section that allows SLPAs to or their supervisors or SLPs to get their CPD, that includes accredited institutions of higher learning, organizations approved under the legislation, which includes ASHA, American Academy of Audiology, or the California Medical Association and their continuing medical education program, and then other entities approved by the board, which would be our PDP providers, professional development providers, where the board, they apply with the board and we approve them. But the May meeting, the committee said that SLPAs should be allowed to satisfy these requirements through the same providers as their CPD or their supervisors. So the committee may also wish to consider the following and whether it wishes to statutorily defined independent study programs to have the same meaning as self-study, and whether SLPAs should be prohibited from using coursework towards a master's degree that would qualify an applicant for licensure as a speech language pathologist pursuant to BC Business and Professions Code, BPC, section 2532.2, towards meeting the SLPA CPD requirements. So part of what we're considering here is if we're going to expand the ways in which they can do so, do we want to make sure that it is defined, that we define independent study to have the same meaning as self-study so they can do non-live coursework using CE providers and CPD providers? And then the other question for the committee is whether or not those SLPAs that are looking to get an advanced degree can use those courses as part of the advanced degree towards their CPD, or if it should be separate, with the thinking that CPD for a SLPA is intended to improve their practice as a SLPA, not to improve their educational attainment towards licensure for something else. So inside of the text, if you go right past the orange divider, you'll see in there some of the simple changes about associate's degree, but then you'll see that courses offered by entities listed in paragraph 1 of subdivision E of section 2532.6 would be added so that they could also take CPD courses. It would also specify, and this is in the statute because the statute has to move first before we can amend a regulation. It would also say that independent study programs shall have the same meaning as self-study as defined by the board and regulation. So essentially, they could also take the non-live self-study courses. Now, the one provision in the question mark is, should coursework from a master's degree that would qualify for licensure as a speech-language pathologist not be allowed to be used for those requirements? Because specifically, those master's degree courses are intended for licensure as an SLP and not towards your provision of services as a SLPA. So those are the two questions we have for the committee, and then recommend to review and discuss and determine whether or not you would like to recommend it to the board tomorrow about using this as part of our statutory language changes in the sunset.
Thank you, Ms. Burns, for presenting this information. I'd like to open for committee discussion at this time. We could start with the first question, whether we define independent study programs to have the same meaning as self-study.
What's the working definition of independent study versus self-study?
Currently, independent study is not defined in the regulation or the statute, and this change would make it defined in the statute so that independent study could be self-study. And presumably, the supervisor's job is already to direct the CE or CPD of a SLPA. So the supervisor is supposed to be dictating what courses they should be taking. We're not quite sure that's happening in practice, but that is the intention, is that the supervisor would say, you're practicing in these areas, you should go ahead and take courses about this. And if we're going to go ahead and define independent study, it could be a set of courses that are self-study.
Okay, I see.
And of course, all of this comes to light once you're sitting down and auditing people and trying to count what should be there. Yeah. And then remembering initially, SLPAs were created with the idea that they were mostly working in schools and being speech therapy assistants. So we have to remember what the law was originally intended for and now where we're at. And that next question becomes, you know, if it's not just a bunch of in-services and conferences, what else should it be? And then should it be focused on your work as a SLPA, or should master's degree courses be allowed?
So you're saying the independent study is I mean, what are you seeing when that's put down on a plan?
Currently, we're not seeing it as any sort of plan. Sometimes it's a SLPA decided to take all of these courses and there is no defined, this is your independent study program from their supervisor. And so then we have a problem,
okay.
Right? Because that supervisor didn't dictate it as a course of independent study. And instead they just decided to take these courses on their own.
And when these laws were written, I mean, it was back when we were meeting in person, and I don't know if anyone remembers the correspondence courses where you get mailed materials. It could happen that the independent sub program is where you get the materials mailed out and you send it back to the company. But again, like Sheree said, it wasn't defined. So now that we're here with online courses and
auditing people,
and now auditing, it doesn't have, you know, it might be outdated, and it might be that self-study programs, courses could be what should be in the independent study program.
Yeah. If you're not seeing this term independent study frequently, then that's what I'm just trying to.
We're often seeing SLPAs who have just essentially taken courses they wanted to take, and they're taking them from speechpathology.com and without any sort of direction as this is your independent study program or course. So, and then of course, formal in-service presentations would have been at their school or their work location, workshops, and state and regional conferences is kind of accepted by everyone.
Just want to make sure I'm understanding. So if they're just doing something independently, the SLP is supposed to be guiding the content. So
They are, and unfortunately, finding many SLPAs that have no clue, that have not been guided whatsoever by their supervisor as to what CPD they should do. They just decided on their own to take some courses.
Well, the courses also, are they really speech specific? Because some ECEUs, you could get it, like CPR could be considered a CEU also. Shouldn't it be specified as
No,
specifics?
the language in the law says that has to be concerning communications and related disorders. So that's something our auditor is looking at as the course content. So they're not just like taking any course online, as they're taking like CEUs that SLPs are taking on, the ASHA's CE database or speech pathology online.
They're just currently it isn't written for them to be picking out their own courses and just doing whatever they think is necessary. And of course, in order to change the regulation, the statute's very specific, so we probably need to do the statute first to ensure that we have the authority when we get to the regulation.
Do we have any guidelines on in-person versus self-study courses to meet the requirements for recertification?
Yeah, synchronous.
Currently, there is not for SLPAs. There are for SLPs and audiologists. Because again, the board's regulations currently pretty much mirror what the statute is.
Oh, okay. So that word independent can't easily be removed?
It could. Independent study courses were in the past something that would be more common. They are not as often anymore, but we could. The other point being is, do you just want to define independent study as self-study courses? Or do you not want that? And instead, in the regulations, the committee would like to look at advancing some sort of self-study versus live requirement, similar to speech language pathologists and audiologists. And I would remind you that SLPAs are paid less, so that would be one other consideration to keep in mind.
Well, I'm just hinging on this word. I mean, could it be just asynchronous? Can we do something that tends towards, okay, it doesn't have to be a live class, and they can do something that's recorded and do the course review or the test? Does it?
Well, if you only want that, courses offered by entities listed in paragraph 1 of subdivision E of 2532.6, those are also the approved providers and CE providers. So if you do not want to specify that independent study should be self-study, we can remove that, but keep the part where it's courses that are approved essentially for the same for SLPs.
Mm-hmm.
And that coursework from a master's doesn't count. So we could remove the sentence that says independent study program shall have the same meaning as self-study.
They count or not? Okay.
Do you guys also want to remove independent study program from the list?
I hesitate to remove it in case there are supervisors out there who are dictating an independent study program for their SLPAs. We just haven't run into it yet for auditing purposes. So if a supervisor had set up an independent study program where they specify the courses they want them to take.
But wouldn't that be on the directive? I don't know why independent study, that word I'm hinging on. I mean, they would be guided on what courses to take anyways.
Should be.
Yeah, I mean, it just was, I think the few sentences before it says that the supervisor acts as the professional development advisor. So in the law, it already states that SLPAs are supposed to be going to their supervisors to determine what courses they should be taking.
And maybe I'm not understanding the operational definition of an independent study still, but if the supervisor is giving the SLPA topics or a list of courses to take, whether they're synchronous or asynchronous, and have this laid out for them, then why would we need the term independent study? think that's what I need clarification on.
We could also define independent study only in regulations and not as part of the statute. There's that opportunity as well. Right now, the biggest problem is that they aren't just allowed to have courses that are regular CE and CPD by speechpathology.com or whatever platform they're using. They have to do an independent study program or formal in-service workshop or conference.
Okay.
So the next question would be, is we could always define what independent study
Yes.
program means in
Yes.
regulation instead of the statute.
Yes, that would be helpful. E.g., and whatever those applicable methods or forms of independent study programs that are allowed. Yes.
Okay.
Because I might not be the only one that's confused on that.
Yeah, we could definitely, when we talk about regulations, we could definitely do research on what that may look like today.
Okay.
And I would suggest that SLPAs have been confused about what that means as well. Because they think, well, I independently created it. And we're like, that's not what it's intended to mean.
Right.
Yeah.
But we just haven't defined it.
Okay.
Okay.
All right. So yes, define the independent study programs.
In regulation.
Yes, in regulation.
And then the next question is whether or not courses towards a master's degree program should also count as CPD, or if they should be excluded. The exclusion language is what's in your noticed material. Coursework from a master's degree that would qualify an applicant for licensure as a speech language pathologist pursuant to section 2532.2 shall not be used to satisfy this requirement.
Shall not be used.
Do we want to keep that or
Which line?
right here? Right.
Should be prohibited from using. I would like to keep that. As you've stated, the master's degree is totally different from enhancing your practice as a speech language pathology assistant. It's more of preparing you for a different role rather than increasing your education to be a more effective SLPA.
Could you hear him okay?
Yeah, it prepares them for a different role.
Yes. I agree.
If all of you agree, then it would be the request of staff that you go ahead and move to recommend the board the legislative proposal to be included as part of the board sunset review as amended, since we are removing
Yes.
the part
Okay.
about defining independent self-study. Independent study program, etc.
Okay. Right here, so you're gonna add. We're gonna add as amended in the. Okay, that's amended. Okay, thank you. All right.
And then I would clarify once the action is taken as part of the sunset review and the legislation has been changed, then the board would go ahead and initiate a rulemaking package. So this would come back to you the next time as a rulemaking package.
Okay. Thank you for that clarity. So given the amendment, right, what we're after our discussion, the motion still remains the same, correct?
Yes, just as amended instead of as noticed.
Yes. Okay. Thank you. All right. Do we have any further committee discussion? Okay. I'd like to ask for a motion. And there's suggested motion language on the bottom of page 2 of 2.
I can do it.
Okay, thank you.
I move to recommend to the board the legislative proposal to be included as part of the board's sunset review as amended.
I second.
All right, thank you. Here at the Glendora location, we do not have any members of the public present for public comment. Are there any members of the public at the Sacramento location?
There are not.
Are there any members of the public at the City of Industry location?
Hi, this is Karen. There are no members of the public.
All right, thank you. So at this time, I'd like to ask the moderator to open public comment on WebEx.
WebEx is open for public comment on the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. And our first request is coming from Nicole Wilson Friend. Hold on just a moment. We're sending you a request to unmute your microphone.
Hi, board. I appreciate the clarity on this proposal. I would also, again, like to beseech you to talk to SLPAs who are currently working and completing our continuing professional development every 2 years. Even though it is delegated to our SLP supervisors to kind of, chart our path for CPD, that does not always happen. So I would appreciate some feedback from SLPs for the board so that there's more clarity on what the actual practice is while we complete these CPD units. Thank you.
And that appears to be our only request for public comment at the moment. Do you wish to continue with the motion?
Yes, thank you. I'd like to ask Ms. Burns to conduct the roll call vote.
Ms. Dominguez,
Aye.
Dr. Chambers,
Aye.
Mr. David,
Aye.
and the motion passes.
All right, thank you. Moving on to agenda item 6, we are going to adjourn the Speech Language Pathology Practice Committee at this time at 2:44 p.m. Thank you.
Next up will be the Hearing Aid Dispensing Committee, and we'll get to that slide to get that going.
Good afternoon. This is Todd Borges, Committee Chair for the Hearing Aid Dispensing Committee. Let's start with a roll call. Myself, Todd Borges, is here at the Response Road address. Dr. Chambers.
Present. I'm here at the Galeras Family Education Center in Glendora.
Thank you. Dr. Sanders.
I'm here at the Response Road location.
And Dr. White.
Also here at the board office at Response Road.
We have no public members here at Response Road. Are there any public members at the location where you're at, Dr. Chambers?
No members are here at the Galeras Center in Glendora.
And what about the other location? Is it City of Industry?
This is Karen. There are no members of the public here.
Thank you very much. First item on the agenda is public comments for items not on the agenda. If we could please open the floor.
WebEx is open for public comment on items not on the agenda. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. As a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. We're going to take just a few more seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Please. Agenda item number 3, discussion and possible action regarding post-fitting counseling and foreign body in the ear canal as stated in DPC sections 2538.11, 2538.36, and 2539.6 and Title 16 CCR sections 1399.125 and 1399.126. Mrs. Lawrence, would you like to take a stab at that?
Yes, thank you, Mr. Borges. Since December 2023, the Hearing Aid Dispensing Committee has been looking at defining the terms post-fitting counseling as used as Business Profession Code Section 2538.11 and foreign body as used in Business and Profession Code Sections 2538.36 and 2539.6. and to permit hearing aid dispensers and dispensing audiologists to remove hearing aid domes. This is in response to an inquiry the board received in July 2022. We have brought the text back with the changes made from the previous, the last meeting in May. The only question we have is we were talking about whether to use the word otoblock or ear dam. And so just taking a look at, like I mentioned before, we're always wordsmithing regulations and doing research of what language, like what is being used. And so I did find other words used, such as phone stops, that are used, you know, when people want to order online, to also ear impression pad to also mean ear dams and otoblocks. And even in the occupational labs report, we also call it a blocking material. We'll take an example of cotton dam. Don't know if the committee wants to still continue using, I think we're using currently ear dam, for something more encompassing, such as ear impression blocking material. It doesn't matter. It's just, that's just what I've seen online, the different ways of describing the stuff that blocks the the impression. Yeah.
I mean, I thought ear dam was all encompassing. If we want to be more precise, if that's, you think that's needed for the regulation to be very precise as ear impression blocking material, but I mean, ear dam is, and that includes cotton and foam, since there are 2 different materials we use. So I'm fine. Do you guys have any thoughts?
I don't have any disagreement with changing it to ear impression blocking material if it's felt that that's more clear.
It doesn't matter.
Ear dam is kind of, and we talked about this before, there's some like old school language versus otoblock versus, so
Right.
it's kind of, it might be a generational difference. So if it's less generational difference and more clear to say ear impression blocking material, I don't see why not.
I mean, I always called it otoblock, but
yeah,
me too.
Yeah.
But
Yeah, no,
Then we have the conversation
Yeah.
of tissue versus
yeah,
cleanup.
Right.
and actually otoblock is not a trademark brand kind of thing. Actually, it's an actual term that's used. It's just, it's used interchangeably with ear dams as well.
Right.
So it's just, I mean, if you're using ear dams in, you know, private practice, it's in the VA and that's common language, then yeah, that's fine.
We just need to make sure it's the language for the most generic version of them all.
Yeah, so then I would say what you suggested is the most generic.
Ear dam or ear
Ear
impression?
impression blocking
Impression
material.
blocking material. That's incredibly specifically generic.
And that will last forever.
Right.
Exactly.
That's not going to be
Yeah.
generationally changed because that's always
Right.
what it's going to be.
So that's fine.
So we could have another word in the
Right.
future.
Exactly.
Okay.
So ear impression blocking material.
Yeah.
There you go. Right.
Okay. I did have one other question that came up. Is if we look at on page 1 of 2 of the actual text, regulatory text, and we have under B3 that we're identifying that the hearing aid dome is before the second bend of the ear canal. How are we verifying that the person knows where the second bend of the ear canal is?
Well,
They have to identify it as part of their examination, but they cannot fail the examination and not know where that is. It's just one small question.
Oh, you're talking about the practical
Yes,
exam?
correct.
Right, well, right, but that could be, I kind of see that as maybe part of the training where you're taking the 5 domes out,
It absolutely could be.
right? I mean, how do you know how do we know the person who passed the test can do any of it competently, right?
Yeah.
So, I mean, at a certain point, I think you just have to.
And I would think too, have a certain way, if they do it and it injures somebody, then that's, the more investigation will be completed and they consider malpractice.
Yeah, I mean, that's, you have to kind of pick that, try to pluck that out. I understand what you're saying, absolutely, but I don't know if there's any way to
Would it be
quantify other than saying, okay, when we have the person, do the domes, that they're identifying where it is in the ear. And that would be a part of that process, right? Because we want to figure out, okay, what do we want to include as to taking the dome out of the ear 5 times?
So
Make
is,
that a part of that process.
okay, and is that process something that we're planning to define? Because we haven't.
Right.
And so I don't know that we are.
Well, I
other
mean, I
than-
think this defines it, right? Because this is saying when you can't, when you can and can't take the dome out of the person's ear. But you're talking about how do we then add that into a training component?
Correct.
Right.
So like on number 2B2, where it says they performed a minimum of 5 supervised hearing aid dome removals supervised by an otolaryngologist or a licensed audiologist. If that's the extent of the process.
So then we add in a sentence in that one saying, has to be able to identify where in the ear the dome is placed.
Yeah, or
Successfully identify where the dome is placed in the ear.
well, or to include identification of the second bend. Right?
They don't have to do that during their practical when they're placing it in.
When
I don't know how much we can talk about.
Yeah.
The topic of anatomy is a portion of our hearing aid dispensing exams, written and
I was
practical.
going to say that's in the written as well, so it's covered.
Anatomy is, yeah.
Yeah, it's covered basically twice, both in the written and the practical.
Mhm. So would it be too onerous, or does it not make sense to just include under 2 that the supervised dome removal would also include identification of the boundary, the second bend boundary? Or is there a reason we can't?
Your regulation, you're specifying it, so.
Just to.
I don't think that's too onerous, and you're doing it all at the same moment,
Right.
so it's easy enough as you're looking in the ear to take it out, to be able to identify, no, it's not past the second bend, it's before the second bend. So yes, it is safe for me to remove it from the person's ear.
Mhm.
Kind of a declaration type of a thing. I don't think that's unreasonable.
Okay. I think that would just clarify or beef this up just a little bit more to.
Right. Other than stick it there and pull it out, stick it there.
Would you want them to be able to identify each time they do the 5?
Yeah, I think they would have to,
supervision?
right? Because
Okay.
it might be before the second bend the first 2 times, and it might be beyond the second bend the 3rd time. So yeah, I don't know if anyone's going to necessarily make it that difficult, but you're looking in the ear to pull the dome. I don't think it takes anything but a moment to identify where it is in the ear canal.
Yeah.
So.
Yeah. And I mean, it can be kind of nebulous and difficult depending on the shape of the ear.
Right.
And part of it is most of the time you should be able to see it with your naked eye, right?
Right.
Without like
Theoretically, though, some have those 90-degree
exactly
angle
right.
ear canals where you can't see anything.
Right. Straight up.
Yeah. So yeah, but that's going to then be on the onus is put on the person doing the
supervising
training.
Correct.
To be able to do that.
Yeah.
Right.
So if you guys are okay with it, I feel it'd be a little bit stronger just to have, that as part of number 2, as part of the Could just be an addition in the sentence somewhere.
What are your thoughts on that, Dr. Chambers?
Yeah, that's reasonable.
Thank you. I'll give one more reason. Awesome. I also actually have another question myself. On page 2, A, the significant air-bone gap means the difference between 15 decibels or more. Pure tone thresholds 2 or more succeeding octave frequencies of 500 hertz through and including 4,000. I would like to see that mirror the FDA and specify 500, 1,000, 2,000, and 4,000.
Yeah, I did saw that.
Yeah, I would like that to mirror the FDA, just because that's all of this is basically mirroring those red flag things. So I think we need to actually.
Yeah, these are very old regulations.
Yeah.
And then I did notice, because I was curious what this air gap meant. And so I was looking into it and I was like, oh, it looks like it could use some updating. So
Todd, what exactly is the FDA language on it?
When you look at the FDA, when you're saying yes or no, it's is there an air-bone 15 dB air-bone gap at 2 or more succeeding octaves at 500, 1,000, 2,000, and 4,000. So see, the way this is written, it implies this is a 750, is it 1,500, is it 3,000?
Oh, I see.
You know,
It's still 2 or more, and it's just defining
2 or more,
each of
just
the
defining
frequencies.
those 4 frequencies,
Okay.
just in case we're not. So there's no so that way we're not potentially kind of coming at loggerheads with what the FDA is.
Okay.
Thoughts on that, Dr. Chambers?
Yeah, I agree. No concerns there.
I can't see you, so I need to make sure you're there.
I'm here.
Okay. Does anyone have any other questions or comments concerning that?
I think our right council has placement for the language you were speaking of, the identifying the second band. If, do you want to
Yeah, for just under subsection B2, where you want to add the ID, would you have it amended so it's said something like they performed a minimum of 5 supervised hearing aid dome removals to include the identification of the second bend of the ear canal?
Yep,
and
right.
Would you want that to be verbally, like they would say it out loud, the supervisor would acknowledge it, and then they would move on?
Right.
Okay. Thank you.
Okay, if we could open it up for public comment, please. Again, we have no one in the public here at the response road. Anyone there at City of Industry? Did anyone walk in the last 10 minutes?
Nobody here in the City of Industry.
Okay, and at the Family Education Center?
Nobody here in Glendora.
Thank you. If we could open it up for public comment, please, on the web.
WebEx is open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a moment now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda? You might be on mute.
I was, sorry, my mouse was not clicking the thing.
Yes, let's continue. We're now on to the discussion item number 4 on the agenda. Discussion regarding hearing aid dispenser training, supervision, and operations at a primary and branch locations of their supervisor as stated in DPC sections 253.27, 253.28, 253.30, 253.33, 253.34, 253.35, and 253.53, and Title 16 CCR sections 1399.114, 1399.116, 1399.117, 1399.118, and 1399.119.
So this was at your request that we talk about this issue.
You're welcome. So we can carry on talking about it. So part of this is also that we need to clarify the statute first and then talk about some of these definitions and regulations. So first we'll tackle the statute, and that's always where you got to go first if you're changing these things. So last time the committee determined that allowing a hearing aid trainee to maintain a branch office license would be inconsistent with the Business and Professions Code prohibiting such things. But that we also had needed to have a conversation about what does it mean to maintain a branch office location. And then the committee identified that the words manage and independently operate a business as used in that section 2538.30 in the Business and Professions Code was being defined, could be defined in proposed regulations. So we could include that in attachment B as we're talking about what does it mean to manage and independently operate a business? And then, let's see, the committee determined that the word maintain may not accurately capture the situation in real life where hearing aid dispenser trainees may be in, and suggested that statutory changes could be considered. The committee discussed at its May meeting that businesses could be maintained, operated, or managed by a different hearing aid dispenser or office manager, and that businesses could also be maintained by someone that is not the hearing aid dispenser, but instead by a corporation, partnership, trust, association, or other like organizations. And so the committee also identified the word temporary should be clarified and suggested that the statutory changes should be considered. So we looked at A. If you look at attachment A, we're talking about here a temporary basis, meaning a limited and short period of time that is not intended to occur repeatedly, is one opportunity to define a temporary basis in the statute. It also has clarifications here on essentially who should it be. There was a lot of licensee used here when licensee could mean all three of the types of license instead of specifically the hearing aid dispensers, the permanent license. So some of those changes are made. And then the discussion questions are that do the proposed statutory changes remove any confusion that implies a hearing aid trainee is allowed to maintain a branch office license? Do the proposed statutory changes address concerns that a hearing aid dispenser may not necessarily be the one maintaining a business? And then do the proposed statutory changes address clarifying that the word temporary is meant to be short-term and non-reoccurring? So if we look at the statutory items first, because that's what we need to concern ourselves with first, is to clarify the statute. Are these changes clarifying? Do they meet a better definition of temporary basis? Does it clarify these duplicate licenses really meant to be the branch office? And that it's a hearing aid dispenser that has branch offices, not a trainee.
Yeah, I think the removing the word duplicate and replacing it, more specifically, I found that to be much more clear. So I think that was helpful as reading through it.
So if I can, let's jump to 3 first, because I think that's the easier one. Kind of get that kind of out of the way first. So essentially it comes down to the one sentence you have here. And the only question I have is, does it have to be, or would it be advantageous to be more specific? Limited and short period of time is very ambiguous, and I can just manipulate the bejesus out of that. For what does that mean? Is that 6 times a year for 3 months, or so I feel like that needs to have some sort of quantitative.
And would you be wanting to ask for that to be in statute, so it'd be very carved out and permanent versus defined in regulation? Because limited and short period of time could also be clarified in the regulation.
That seems to be the simpler
It's up to you guys.
and more
Again,
direct fix, right? I mean, the statute is a whole thing.
and often statutory language is broad.
And as long as it's clarified, getting clarified in regulation, I'm fine with that. At least we have some sort of clarification somewhere that we can point to go, no, you can't do that because it says here, you're now way out of bounds for what would be considered temporary.
Well, and then it's more easily adjusted.
Exactly.
If we find that our initial decision is we're finding issues like, oh shoot, we made that too long. We should have made it shorter,
Right.
or vice versa.
I thought we were right the first time.
Yeah, all the time. So I mean, I think in statute it's probably better not to define it specifically and then allow that for the regulation side. So
I agree. The regulation that gives us a little more fluidity of adjustment.
And the ability to relook at it without having to go back to the legislature.
Mm-hmm.
And then it does says at the end that it's not intended to occur repeatedly, so I think it covers like the multiple times a year.
What does repeatedly mean? Does that mean more than 3 or more than 6 or?
Yeah, I don't disagree with you, Todd. I think it will be important to define that more specifically, but I think doing it in right.
They're going to push. People are going to push the limit.
Yeah.
Yep. So I think we need to have some kind of a limit established, just for clarity's sake. I'm a fan of loopholes only when it's to my benefit. So and that's a big loophole. Okay.
And then, of course, right now, we're still going through the trainee and temporary regulations, so they're still in flux. So that would allow us kind of get that statutory provisions updated and then readdress the trainees and regulations.
Okay. So we want to jump back to 1. The first discussion question: do the proposed statutory changes remove any confusion that implies a hearing aid trainee is allowed to maintain a branch office license? I have to say no. I'm still confused. Well, I mean, it doesn't really specifically address yes, no, that I could see. I mean, there's a lot about the beginning of it talks about the denial and suspension, how you can get, who can be a supervisor, when they can't be a supervisor. Then it goes through the training required, but I don't necessarily see where it says, and then we talk about, okay, the supervision requirements. That really throws me off because we have direct supervision and immediate supervision, which now means there's no 80-20.
There's no indirect supervision.
Okay, but the supervision has always been, to now, 80% could basically be indirect and 20% is direct. Now, according to this, there is no indirect. So we're saying the person has to be physically with the supervisor 100% of the time.
In the same building.
When doing those items.
Well, when doing those items, which is basically everything, because it's the practice of fitting and selling hearing aids. So that's everything, basically, other than services. I mean, servicing wouldn't be covered by that, but that's not what you're training them for, in the end.
The statute prohibits them from managing a business, so technically it shouldn't be on their
Well, but
own.
then we're also talking about what is you said, what does managing mean? What does maintaining mean?
Yeah, and I mean, for the purpose of trainee on page 7 of 8, there is a definition to manage, which means to be in charge of, oversee, or administer day-to-day operations of a business, which engages in the fitting or sale of hearing aids.
Okay, but then you're assuming that because I'm in an office doing hearing tests and fitting hearing aids, that I'm also managing that office.
That's true.
And I'm not necessarily managing it. I'm just there doing testing and fitting hearing aids. There could be an office manager in the office that's actually managing the office.
I think when it comes to the level of supervision, I think the goal was to increase the level of supervision to ensure that they can pass the examination sooner than later, towards the end of the 18 months.
Well, and it was also meant so that we couldn't have this situation where a trainee is off at another location, essentially seeing the patients independently without direct supervision. So I think actually, Todd, that the supervision requirements make the whole thing more clear about a branch
Yeah, it
issue.
does. You're
Because
right.
you can't go off and have them floating a trainee off
Right.
that branch without their direct supervision.
And that's why I want that clarification, because the way the supervision was in the past. So we're talking about fundamentally changing the supervision of trainees entirely.
Yes.
Yeah, future.
Okay.
Which had been talked about previously all by itself.
Right.
Yeah.
And also clarifying that the board, myself included, should not go on a website and see this branch, this location has only one person and it's actually a licensed trainee, and that no one else is attached to this location. And that's where the presumption would then be that person's independently operating and
Right.
managing that location because no one else is associated with it according to the board.
I have a question. So Todd, what if, what's your boss's name? Or the one that I used to know?
Are you referring to Rochelle?
Rochelle. So what if Rochelle, as a person who's managing and operating the business, was not a hearing aid dispenser of any kind, chooses tomorrow to want to become one?
Okay.
How does the managing and operating prevent her from doing that? Would she have to stop doing that in order to become a hearing aid dispenser?
She goes the route of being a trainee.
If she goes a trainee route, which you aren't required to do.
You can independently just
Take
take
the
the examinations,
Take the
and if you
test.
have,
You can lone wolf it and just not sign
You
up
do
for
all the
anything
stuff, you
and
just
just
sign
do
up.
it. Yes.
Because you're there observing every day anyway.
Right, was the bejesus out of me to begin with. But that's a whole other conversation. But yeah, I mean, because when you look on the executive report, you'll see the list of the tests and, who passed and who failed. And there's that one line item that says,
Yeah,
the
those are the
supervision or
situations I
whatever.
can see.
And you have like one or two people every time that are in that, whether they,
That's the only situation I can see that prevents. If it wouldn't, then.
Right.
Yes.
Okay. Okay, so, and then in that regard, then with the branch license, if I have a trainee working under me, then I would have the branch license. Because, and then they would just basically track me to the office, but they don't need a branch license because they're still working under my
they're working under
license.
your supervision.
Right.
And they're associated to your license. So a lot of this is about what is the board seeing when we look at it? We're seeing, right now, we're seeing what looks like independent operation of a location because I don't have a supervisor attached to that location and I don't know is that supervisor ever there? Who's managing that office? I only see a trainee and an office assistant. What does that mean? And this would hopefully clarify that I would need to see as the board, and mind you, I'm not always going to go to every location to observe this, right? That you, the supervisor, have these branch locations and these supervisees who are also attached to your license are over at these locations.
So just out of curiosity, this is one thing I think of, because we're talking about dramatically changing the supervision. And I'm wondering, in the 40 years that this has been done this way, 30 years at least, have we had a preponderance of complaints or issues with trainees that were in an office on their own, causing harm to the public?
I can't speak specifically, but I have instances where there was a complete lack of supervision of trainees, and the complaint is regarding some of that. Is it a preponderance? No, but we don't always get a lot of complaints.
Right.
But I can think of one where it is a consistent pattern of lack of supervision by that supervisor and multiple complaints of not refunding and proper procedures at said locations.
Right. Well, and to the case you're referring to in that regard, probably because the person whose license they were under isn't doing that either. Right. So,
Todd, can I?
I mean, I'm not necessarily against this per se. I'm just trying to get a little sense of the history and where we got to this all of a sudden.
Wait, this was not all of us.
Well, I mean, okay, now all of a sudden, like today,
We all
I'm just,
discussed
as
this
we're
at
putting
length.
through. Well,
Well, the reg.
I don't remember discussing getting rid of the
Supervision, we discussed at length.
Okay.
It's been a while.
It's
Yeah.
been a couple years.
It's been a couple years.
All right, well,
reviewed and-
okay.
But
Yeah,
for
well,
now, the statute part is the new part, and the
Right.
clarifying, hey, trainees, you shouldn't have branch licenses because that's implying that you have a branch that is yours and that you are maintaining and operating independently, which
Right.
should not be happening. And that's where, when you asked, I was like, whoa, that to me is clear in the statute, but obviously it was not clarified for staff and for the community. And therefore we do have trainees with branch licenses currently. And this is something that we need to clarify and then remedy. Separately, we've been looking at the trainee supervision requirements for quite some time, including the long list of things they need to be trained on. It's just been a while. But kind of connecting them all together and clarifying via the statute. I would tell you that I have run into other situations where it's not always a complaint, but the board is seeing it and the board doesn't have anything that clearly says it in the statute that it's not allowed. So alternatively, SLPAs. Owning and operating a speech clinic is them employing their supervisor, but yet I don't really have any prohibitions of such conduct at the moment. There's nothing in statute and there's nothing in regulations. While it's clear to me that's conflict of interest and that you should not be able to employ your supervisor, there's nothing in the law telling it to be so. So right now, I think the board, seeing things in practice, is looking at cleaning it up for all supervised categories, trainees, SLPAs. I don't usually see it with aides, but aides and what they're supposed to be doing, and cleaning up all these categories, right? So a hearing aid trainee shouldn't be operating their own branch. Right. It should be your branch and that they're doing it under your supervision, and that's clear to them. It's clear to the public, because again, I've looked at multiple locations and the only licensee there is a trainee. That's where it should say, there's this hearing aid dispenser who's the supervisor of this one. You should see two, right? Whether or not you're there every day is
under the old rules, that was perfectly acceptable because it was 80% essentially unsupervised in essence, and 20% supervised. So under the old rules, that was perfectly acceptable.
Well, I would suggest that 100% of the time you're still under the supervision of your supervisor. You are just under indirect supervision.
Right.
And the difference being that that should mean that the association is there all the time. And that's why these should be clear, but they weren't really established well in the statute and they weren't clarified in the regulations either, because unfortunately we just haven't gotten to touch all these cleanup areas in quite some time. And that's where I think we should be very clear. And I think we'll be addressing it hopefully on the other side of the house as well. I shouldn't see SLPAs owning clinics, because SLPAs owning clinics and employing their supervisor is a conflict of interest. So these are kind of like in the vein of the same concept. So, which you might see in future tabs, I believe, about not owning and operating their own business.
Yes, yeah. And the technical changes.
Okay.
We're proposing that. But for like the purpose of today's discussion, we're looking at statutory changes. We will look at the regs again in a different discussion when we're reviewing the HHP's letter. So we can also talk about more about the level of supervision and do we want to go back or keep the current or go with the proposed
or with the board chair like to read.
Yeah, so we could definitely continue the regulatory discussion at a later time. But for the purpose of this agenda item, we're looking at the statute since that's where it needs to start first. So we're looking specifically at the statutory language regarding notifying the board of the addresses where licensees are engaging in the practice of hearing aid dispensing. And then the section after that is regarding having an established business open all the time or open for clients, but as well as if you're going to be engaging in it's the one pager text. If you're engaging in the practices of hearing aid dispensing at other locations, that you need to register for the branch office, and that a hearing aid dispenser is the one doing that, not every licensee.
And then my guess is we'll have a broader conversation when we're talking about the regs that'll have all of the sections in it.
Right. Okay.
Yeah, and I mean, like Sharice mentioned, it's it's been a while since we looked at it due to other regulatory, and it is on the agenda hopefully for the next year after we complete the DGs. So it is something we are going to be looking again. Because I do, like I mentioned before, a lot of wordsmithing, as I'm preparing the rulemaking document. So there are questions I do have with the text as it's currently presented today. So the committee will have an opportunity to take a look at the text in the future.
Okay, well, I think that also answers discussion question number 2. That they address concerns that the hearing aid dispenser may not necessarily be the one maintaining the business. When we talked about that, what does maintaining mean?
Yeah, because it sounds like we're talking more about engaging in the practice instead of like who's owning the business or running the business, because that could be also a non-licensed person, right? So I think going with that language related to businesses might be best when it talks about other businesses.
So then we're discussing item that would be C on the one pager.
B, yeah, where it usually says if a licensee maintains, it now says a hearing aid dispenser engages in the practice.
Right. Okay. Yeah. Okay.
We have to word these quite differently than the speech and audiology side because they have different requirements on the speech corps and those kind of things versus those restrictions aren't the same there.
Yes, it did, after all the items you mentioned about who's maintaining the business and somebody else you're just visiting to provide services, it did make it a little tricky, but I think this language it covers what I think you were hoping to look for that.
Nothing, not tricky. Dr. Chambers, do you have any comments or thoughts about this?
No, nothing to add. Thank you.
Thank you.
So at this point, we just need to know, do we want to move on making these statutory changes as part of the sunset review to make it much clearer about what's going on here? Or are there any things we need to add to this to make it clearer?
In that regard, I think it's relatively clear. Do you have anything that you would
Just that more specific about the temporary basis.
right?
What we're going to do that,
Temporary.
right?
Yeah.
Okay. So I'll move to recommend that to the board, the legislative proposal to be included as part of the board's sunset review as notice.
And I will second it.
Okay, we have no one in the public here for comment. Do we have anyone at either of the other 2 locations there for comment?
This is Karen from City of Industry. There's no one here for public comment.
This is Tamara Chambers here in Glendora. No one here for public comment.
Thank you. If we could open up web for comment, please.
Absolutely. WebEx is open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Please. Ms. Burns, if you'd call the roll for me, please.
Absolutely. Mr. Borges?
Aye.
Dr. Sanders?
Aye.
Dr. Chambers?
Aye.
Dr. White?
Aye.
Motion.
Thank you very much. And that concludes the hearing aid dispensing committee. Next item is adjournment. Thank you all very much. Appreciate it.
And it's 3:26 p.m. Do we need a break or are we okay to go? I would recommend a 15-minute break.
Okay. We'll take a 15-minute break and then we'll start the audiology practice committee meeting.
Pet cats.
You can.
All
We've
right.
seen those. We've seen
Cat kids.
You've seen that Tracy like
Oh.
cats.
All right. So make sure everyone's back. All locations. Yep. So I'd like to go ahead and check in with all the locations. I'll do a roll call and just have all the locations check in with us. So we'll start with Karen Chang.
Here, and should I say where I'm at?
Yes, please.
Okay, Karen Chang. I am at the law office of Scott Wormuth, 17700 Castleton Street, number 168, City of Industry, California 91748. And there is nobody in there's no one here with me.
Okay, great. Thank you. Dr. Chambers.
Hi, I'm here at the Galeras Family Education Center, 427 West Carroll Avenue, room 1, Glendora, California, 91741. No members of the public are here with me.
Thank you. Dr. Sanders.
I'm here at the board office at 1601 Response Road, Suite 260, the second floor in Sacramento, California.
And I am also at the board office at the Sacramento location. There are no members of the public in the room. All right, so we will move on to item number 2, and that is to open up for public comment for items not on the agenda.
The moderator with us.
Moderator is here, expecting physical locations first, but willing to start with WebEx if you prefer.
Nope, we appreciate that. There is no one at the Sacramento location from the public. Karen, can you confirm as well, City of
Yes.
Industry?
This is Karen, and there is nobody here with me.
And Dr. Chambers, if you can confirm the same.
No members of the public are present.
Thank you. Thank you, moderator.
Are we ready for WebEx?
We are, thank you.
All right, WebEx is open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few moments now to see if we have a request for public comment. As a reminder to our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. Seeing no request for public comment, do you wish to continue with the agenda? You might be on mute.
I am, it's my mouse.
Yes, please. Let's move on. Okay, so moving on to agenda item 3, which is discussion and possible action to amend regulations regarding general application requirements and speech language pathology aid and audiology aid requirements and scope of activities, duties, and functions as stated in Title 16 CCR sections 1399.151.2, 1399.151.3, 1399.151.4, 1399.154 through 1399.154.12 and 1399.157. Ms. Ferranza, would you like to take us through?
Thank you, Dr. White. Since November 2023, the committee has been reviewing proposed regulatory changes to the audiology aids. In December 2024, the committee did recommend to the board to initiate the rulemaking process and direct staff to prepare the text for the board review and approval for the sections that apply to the committee. And so attachment A includes those changes made at that meeting. As we were preparing the language for SLP AIDS discussion at the SLP committee, we did wanted to check in with the committee about their definition of the definition of level of supervision for aides, audiology aides, especially after last meeting's discussion regarding assistant, audiology assistant license type. We did notice that there is a differences in supervision between SLP aides and audiology aides that we just wanted to clarify as we prepare for the item for board review. So, like I mentioned, we do a lot of wordsmithing, and so there's included in the summary changes all the things that we've made, similar to what we did with SLP aides, making sure that it's clearly defined the role of an aide. But again, checking in with the committee to see if it's still, if what it decided on in December 2024 is still applicable or if it needs to be changed.
Okay. Do you know off the top of your head exactly where the difference is in the aid, between the speech aid and an audiology aid that you were questioning?
Yeah, so one thing we were looking at is that currently audiology aides would be able to have indirect supervision, which is different from SLP aides. They will not have indirect supervision. So that's one of the things that we did notice that would be different. For sure. And then
this is something we highlight because when it comes to SLPAs, this is where a problem tends to come into view, where the SLPA can provide independent therapy following the SLP's plan, and aides should not. And so making sure that we're very clear, again, that aides are not independently providing therapy because they're not SLPAs.
Can you point to where the only place that I highlighted that had indirect supervision was item, the letters are mixed up. So currently it's on page 13 of 16, item F. At minimum, indirect supervision shall be provided when an industrial audiology aid, yada, yada, yada. That was the only one I found that had reference to indirect supervision being a component. Was it somewhere else that I missed?
Also in A4.
No, that's the definition. E where it says after the 90 days, the last sentence.
Okay, thank you. Indirect supervision shall be provided when the aid is performing indirect client care, such as programming a device or cleaning equipment. So when a patient's not present, then they can have indirect supervision.
Yes, for the audiology aides, for SLP aides, they would be required to have their supervisor in the facility.
Did we give them that, or is it in the other section?
Say again?
Is that in this, did we give them that section, or is it in the other SLP aid?
The second text, so there's two attachments. The first one was what was approved by the committee in December 2024. And then the second one is actually what we should be looking at, which is the text as currently today in 2025.
Thank you, that's where I was.
And so we're looking at page 13 of 18.
Sadly, I reviewed these and I was like, where did our track changes go? And I know they're here, so sorry.
Yeah.
So if you go to page 8 of 18 for the August 8th, 2025 version, that's where you see there the speech pathology aid changes.
So I think I am unclear exactly on how speech language pathologists use aids. I understand how they use SLPAs. I'm not quite sure in what context the aids are used versus a SLPA. I think when we were discussing this indirect or indirect client care, like programming a device or cleaning equipment, my recollection is the thought was a lot of times the front desk person could be also an aide, you know, that they're checking in hearing aids, they're essentially doing mail. Scheduling patients, you know, and that the audiology aide should be able to do those things without having to have an audiologist present to do mail, essentially. So,
And I think that's where we define more of the clerical duties.
yeah.
But I think for audiology as compared to speech, when speech wanted to use them indirectly, it was actually to provide services to patients. And then the question mark would be then, I believe it was like questions of attaching the, oh, I'm trying to think of a conversation from years ago about debriding and attaching, not sensors, electrodes?
Are you talking about for speech?
No, for audiology.
Oh, like cleaning the electrodes before and after, like ADRs or some such?
I believe that's what it was. And or could the aide put on the electrodes?
That would be direct
And
patient
that's
care.
Yeah.
Yeah.
So I think we just want to make sure we're defining it properly. So like essentially the only indirect thing should be not direct patient care.
Correct, which I think is what it says right now in that, not right now, but the one, the item you just called out on 13 of 16, page 13 of 16, the item B. The supervisor shall provide direct supervision at all times when the aide is performing direct client care. At a minimum, indirect supervision shall be provided when the aide is performing indirect client care, such as programming the device, so checking in the device or cleaning the equipment. So maybe that sentence could be more clear. If
Yeah.
that's not
Well, I guess the question is that, just to verify that when we're talking about indirect supervision, we're talking about the supervisors not at the facility.
Right.
And they're just reachable by phone.
because they're doing clerical and mail.
Yeah.
Mhm.
And so, yeah, just making sure that the committee, because currently SLPA aides, they do clerical things and they clean up and stuff like that, but the SLP is still in the building
I see.
as they're doing that.
I see.
So, and that's the only difference between the two.
Is there was there a specific reason why that was made to be of import? Like why that was so important? That they can't do clerical tasks without having their supervisor there? Something that I'm not thinking of, I guess, is what I'm getting at.
Yeah, how does that go sideways?
Normally it's going sideways in the fact that they can be doing direct patient care. I'm trying to think of the other instances. I don't think they're as concerned about the clerical tasks. I think it was that there is such a thing as indirect supervision during patient care. So making sure that anytime we're talking about indirect, it's in relation to non-direct, and I feel like we're saying direct too much. So I think that's the difficulty here. So the audiology aid, when they're assisting, when patients are not present, maybe saying that was a little cleaner than saying direct client care versus.
Well, what patient is not present?
Yeah,
sure.
so that it's very like blatantly clear without getting too much in the terminology. So I think that was kind of the idea.
Okay.
Because we were having too many, at least on the speech side, and that's because there is the assistant level. There's often inside of the application where they're trying to squeeze in split the duties with different words by using indirect and pretty much that there's indirect when they're on site but they're providing the therapy. There's just a whole lot of word trickery that people are trying to use to get essentially aides that are doing SLPA duties. So we just want to make sure we're kind of similarly, quarantine's the wrong word, but like kind of clarifying this is the boundary. So when there's indirect care, there should not be any patient engagement, no patient assistance. You can't be assisting patients while you're doing that. So that the aid is solely for that. And then again, the other difficulty being, I don't think we've had anybody that has an aid currently speak to us often about what are they doing aside from scheduling and cleaning instruments.
Oh yeah, we haven't audited or looked into audiology aid applicants. We only looked at SLP. So we're basing it off what we've seen from SLP is that they supervisors are providing direct supervision, which is being in the facility when as the aid is not working with patients, essentially. And so just stating that there is differences, especially since both SLP and audiology aides do come, the requirement is they don't have training or experience. So just highlighting that there is a difference in supervision. And
yeah, I agree. And I mean, it'll be hard to say if another license category comes to fruition at some point. We'll probably have to readdress maybe the boundaries or the descriptors. But I think, and I won't speak for you, I'd like you to weigh in, but like I think we're clear. I'm of the understanding from reading this, it reads to me as though if there are no clients, there are no patients present, the audiology aide can do their clerical stuff, have indirect supervision. They don't require a supervisor to be present if there aren't any patients present. But if anything regarding, any sort of patient care is happening, the patient is there, it is requiring direct, on-site supervision, and at times immediate supervision based on how this.
So would that prevent an aide from cleaning a cochlear implant on an afternoon where the audiologist is not present?
Yes.
Would it prevent them from cleaning a hearing aid?
If
The audiologist was not present.
if the patient is in the office, they are not able, in this case, if what this says is what we're going with, they are not able to take the device from the patient and go clean it without having a supervisor present. And I find that reasonable. I don't know about you.
I think that would cause a lot of problems in a lot of places because I think that's happening everywhere.
That they're by themselves.
Yes. I know several locations of some people that we know that go to other locations, leave their people behind and still have their same day clinic open from 12 to 1 and are cleaning hearing aids and there's no audiologist on site or hearing aid dispenser. There's nobody.
And there's
Just
patients with them.
Patients walk in,
Okay.
hand them a hearing aid. Can you clean my hearing aid? From 12 to 1 and they clean the hearing aids. Audiologist isn't cleaning those hearing aids. The person who answers the phone is cleaning the hearing aids. That's happening in dispensers offices all over the place. That's happening in audiology offices all over the place. So if we make that rule, it's going to stop some people from doing the things.
It's a hard one because we haven't had any.
We clarify it completely.
We haven't had those boundaries before.
Yeah.
So what happens to all the people that are using the aid currently on approved plans, right? That they had to submit that are doing that. If we were to change that, then you're right. They'd probably have a much wider impact than.
Correct.
Yeah,
Or people would just stop doing it because there's nothing to stop
Yeah, and I
the
guess
secretary from doing it.
and that's why we're bringing it up because we also the way we defined the supervision for the SLP aides is distinguishing if they're in an evaluation or treatment versus or the patient is in an evaluation or treatment versus a patient is not. Because one thing we were talking about was like, what's the level of supervision for an SLP aide to bring a client from or a patient from the lobby to the room? Right. So that's actually was the question was like, what is that level of supervision and how do we describe that supervision? And so giving you guys the opportunity to have that discussion. Yeah.
Well, and that's the difficulty here is they are very distinctly different, right? So in speech, what we were seeing is that people are trying to sneak in that they're assisting because the speech aid is supposed to be what they're having immediate supervision while they're assisting the SLP with the therapy, but they should never just be assisting or was it indirectly being monitored while they're doing therapy. It was kind of like ways to sneak it in to do the work with a slipper compared to, and again, this is the problem with audiology aids, like what are they doing now versus what kind of things do you want them to do if they're helping with those placement of the electrodes. I might screw that up again for the whatever.
The ABR.
ABR. So if they're doing that, should they be on direct, or if there's any patient contact, should it be immediate? Because again, the idea is to assist the audiologist in patient care rather than being providing any sort of patient care. So I think we're just trying to make sure we have all the demarcations appropriate. But it sounds like if we say, instead of saying performing indirect client care, which was the cleaning of the hearing aids, right? And if we went instead to assisting when patients are not present, we'd have a problem with what's practically being done,
Right.
which is the patients are there, but it's because they're waiting for you to clean the hearing aid, which is the indirect client care.
Right.
And that's maybe not something the committee's concerned about, as where if the aide starts to then try to counsel them and go beyond that, then we have a problem, right?
Changing when the texts are overstepping. Then the changing.
Oh yeah, let me adjust your programming without the audiologist
Right,
in.
changing the plan.
In the patient care plan is different.
And maybe making that really clear that yes, they can perform indirect client care,
Such as
cleaning
cleaning a hearing aid, providing batteries.
and mind you, we put programming a device, but we didn't clarify to the specifications of the audiologist. You know what I mean? Like, so those kind of things of, if we have this language, are we opening it up too much? Do we need it a little clearer? Is maybe assisting when patients are not present is too clear? It's too specific, and we need it when patients can be there because they're dropping off the hearing aid. They don't want to
Yeah.
leave without
Service.
taking it back.
Right.
And it's a 5-second.
Yes, but that also, such as programming a device to the audiologist specifications or cleaning equipment. So then,
Yeah.
that way we're trying to clearly delineate this so we don't run into the same problem with speech aids and SLPAs run into, right? Even though we know the other one doesn't exist yet.
So how can we best
Say
say indirect client care would include just simply cleaning a device, right? Like, but nothing further.
I think we have to say it in C, because we first start defining what the levels are in A, and then in C, well, the D is the initial 90 days that they're licensed, but then after that, that's where we'd want to clarify what's appropriate at the different levels of supervision, right? So after those first 90 days of being licensed as an audiology or being competent, whichever is later, except for those services in B and C, which is, medically fragile, and that you've always been trained on what you're doing. Then what kind of levels of supervision need to be provided? Because right now, it's got the supervisor shall provide direct supervision at all times when the aide is assisting with patients. And the supervisor shall provide indirect supervision when the audiology aide, and it could be either what we struck out, which is performing indirect client care, or assisting when patients are not present, which sounds like that's problematic. And then such as programming a device or cleaning equipment, which we don't really put any caveats on either.
And I think the devices should be added. Because equipment is the audiometer. Devices are the hearing aids. Or cochlear implants or whatever.
Can I comment real quick? I think also where you say direct supervision at all times when the aide is assisting with patients, I think that also includes somebody coming to drop off something for cleaning. The way it's a little overbroad, and so I think there's a confusion with assisting with patients. You don't want direct supervision for a drop off of a cleaning situation. And then when patients are not present, that also means they can't be in the lobby. They can't be, and they can't be in the bathroom. So I do think that's overbroad. And you can do some sort of including, but not limited to.
But very selectively,
But
according
very,
to OAL.
yes, they don't love it. But if there's a reason which can be explained, then I think it could work.
The other option being go back to the language that has direct client care and indirect client care, and then define such care, right?
Indirect, okay.
And then
Yeah.
not use the when present and
Right. But indicate you're still gonna have the same issue of
Yeah.
how broad or narrow we
Yeah,
want to define it, so.
And in keeping in consideration how you're using A's is different than how speech is using their A's.
Mhm.
Correct.
So, is there anything other than cleaning that comes to mind that is a common?
Well, it's cleaning and then
Servicing hearing aids.
you could just say servicing.
Yeah.
Because, I mean, the front office person could be handing them wax guards or cleaning brushes or batteries or things that they need, you know, in order to keep their hearing aid operational. So we definitely don't want, I think,
And then also we manage loss of damage claims.
sure, warranty information, but that's,
That's
yeah.
sort of clerical, and then
Correct.
you could say servicing whatever the devices are, and then
Your
say,
devices.
which may include blah, blah, blah. So kind of clarify what servicing means, and leave it to that, and then have a separate, I don't know where it says clerical task, but I think you said it was defined, but then we also have that. Because you want to be able to do that, somebody in the life, you don't want to take that away.
Mhm.
Well,
Pairing the devices to cell phones.
Right.
So the Bluetooth, you know,
That's another-
pairing to
the
your, oh,
enormous-
you got a new iPad and now your hearing aid's not talking to it, let me just pair it. You know, where you're just Bluetooth pairing like you would a headset to a cell phone. That's the other thing. So it'd be pairing, cleaning, or just general servicing.
providing accessories to, or the wax, or whatever, or is that cleaning?
Providing additional
Sorry.
domes.
Yeah, right,
Yeah,
dumb,
but
wax
would be labeled
guards,
accessories,
batteries.
that gets into the
Okay,
weird.
not
that
that
word.
word, that,
Yeah,
let's
it's a
not
bad
use
word.
that word. Okay.
Not use what word?
Accessories.
Oh.
Those accessories are FM systems, or remote mics, the audiologist needs to get involved.
Yeah.
Okay, thank you.
So, what would you call those items?
Supplies.
Supplies.
Mm. So pairing, cleaning, providing additional hearing aids, supplies. Play with that.
Yeah, we also came across the same issue with that in D, where it requires that following the initial registration, the supervisor provide immediate supervision at all times for the first 90 days. We're not sure if the supervisor wants to continue, like for the first night, like the entire 90 days, if they want to supervise them in the same location when they're servicing with patients after a certain amount of training. That
Yeah.
could be shorter.
You might do a carve out, like, I think 90 days of supervision for direct patient care is reasonable. In that first 90 days for sure, because they're learning and you have to verify that they know what you need them to know. But carving out the indirect patient care service, as we're just talking about, I think would be,
Those are much simpler tasks than.
You show them once and then they're pretty good.
more than one.
Yeah.
But
Yeah, like-
you're not going to hurt somebody either. So,
It doesn't take 90 days to do it.
correct.
Yeah, that was one thing we noticed. We're like, I don't know if
90
they
days.
wanna
Yeah.
do that.
Well, especially because the aid scope is limited, right? So as where the slip was pretty broad, they're just gonna shove them in a room with kids doing therapy. So that's, you know,
Right.
again,
This is
sometimes
much
we
more-
really have to like look at what we're doing.
Yeah.
But we often take the same structures, and if it works for another, then does it work for this? And if it does, how does it work? And if it doesn't, does it need carve out, or it's good, but when we're talking about direct patient care.
Like Amy said, when this becomes another discussion of another license sector, so we have a whole different.
It very well could be, but again, I would say SLPAs have been around since 1999. And we still have speech aids. Largely because there are people that will not go get the degree to become a
Right.
SLPA. But that doesn't seem to stop people from trying to squeeze in SLPA duties.
Yeah.
When we already have a carve out, so.
Dr. Chambers or Karen, I'm sorry, I haven't, maybe given you time to speak. Do either of you have any comments on this?
I was just wondering if it's worthwhile just to put, like a of note or a I, and spell out those specific things just so that there's not any ambiguity.
So the thing about like specifying, we have to be careful when we're specifying things in regulations, because then it becomes like too restrictive.
If you put too
If-
many things in there and it looks like an all-inclusive list, then it is the only things they can do. But we can try to define, like we define immediate supervision, direct supervision, and indirect supervision. We could also try to define what is direct patient care services and aid, such as blank, blank, blank. Indirect patient care services, such as servicing hearing aids and providing supplies and cleaning equipment. It gives a couple examples, but it's not saying this is all of the list. This is only the items you can do. The hard part is making sure the list doesn't get too long, because then as soon as it might look like an all-inclusive list, that is what the law is going to call it. And then anything outside of that is prohibited. Is my understanding.
Yeah. And I think what you've provided us will help
Give a
us
couple
to
examples.
figure out what the language should look like. And
So Dr. Chambers, moving forward, like the next draft will have more of that, an example or two defining the direct patient care versus indirect patient care activities. Is that maybe what you're getting at? I think
Yes.
got it. Yeah.
Yeah.
Your questions.
I think we've covered most, I think all of the questions, actually.
Okay.
You know, we've mentioned about the difference between direct and indirect. And if that's the level of supervision that's provided. It sounds like that the regulations will have to be looked at if there is a creation of an assistant. Audiology, thank you. Assistant license type, but that currently that is how they're being used. The language kind of covers what audiologists need. And then clarifying indirect supervision and clerical work and cleaning equipment and making sure that the supervision matches and what is expected in the practice. So.
And then based on the amount of changes maybe that we're talking about today, should we even be doing this motion or should we wait?
That is, yes, that is correct.
Take it off the table.
Okay.
Yeah, so we'll have to, because we'll have to definitely do a lot of wordsmithing to kind of define direct patient care, client care, and indirect. And so I'll work with our reg council with putting that language together, and we'll bring that back at the next meeting.
And would it be reasonable to go ahead and see if there are any public comments about the discussion we just had?
Absolutely. We have to anyways.
Okay. Oh, we have to. Great. Wonderful. Okay. So here in Sacramento, there are no members of the public. Ms. Chang.
Here in City of Industry, there are no members of the public.
Okay. Dr. Chambers.
Here in Glendora, there are no members of the public.
Thank you. Moderator, would you please open WebEx for public comment?
WebEx is open for public comment. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a moment now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, please. All right. So
Hold on a second, moderator. You can hear us, right?
Yes, indeed.
Okay, sorry. We had something that said you're muted for a second there. Never mind.
Okay, so we will move to item number 4, which is adjournment of the Audiology Practice Committee. That is at 4:16.
And are we continuing to the board meeting now, or is it going till tomorrow?
We are going to go ahead and continue with the board meeting and take up a couple items until 5 p.m.
Perfect. All right, thank you. We're back. I'm calling our full board meeting to order at 4:17 p.m. on August 21st, 2025. I'd like to start with Calling the roll. I'll start with myself, Board Chair Gilda Dominguez. Present at the Glendora location, Galeras Family Education Center, 427 West Carroll Avenue, room 1. And I have 2 board members present with me and no members of the public. Dr. Amy White.
Yes, I'm at the board office, 1601 Response Road, Suite 260, Sacramento, California, 95815. There are 2 other board members in the room with me, as well as various members of board staff, and no members of the public.
Thank you. Mr. Todd Borges.
Here, also at the Response Road location.
Thank you. Dr. Tamara Chambers.
Here at the Glendora location.
Mr. Francis David.
Here at Glendora location.
Thank you. Dr. Charles Sanders.
Here at the Response Road location.
Thank you. Ms. Karen Chang.
Here I am at the law office of Scott Wormuth, 17700 Castleton Street, number 168, City of Industry, California, 91748. And there is no members of the public here with me.
All right, thank you. We do have a quorum. Moving on to agenda item 2, public comment for items not on the agenda. I'd like to start with the on-site locations. We do not have any members of the public present for public comment. I'd like to check in with the Sacramento location.
There are no members of the public at the Sacramento location.
And the City of Industry location.
I'm sorry, there are no members of the public at the City of Industry location.
All right, thank you. At this time, I'd like to ask the moderator to open WebEx for public comment.
WebEx is now open for public comment for items not on the agenda. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. Thank you. Moving on to agenda item 3, the review and possible approval of the May 15th, 2025 committee meeting minutes. I'd like to ask Ms. Lorenzo at this time to present this agenda item.
Thank you, Ms. Dominguez. The minutes includes hearing aid dispensing committee's discussion on proposed regulatory changes related to hearing aid dome removal and possible statutory changes to training supervision and operations at primary and branch locations of their supervisor. We also have the Audiology Practice Committee discussion on possible statutory changes to create audiology assistant license, as well as the SLP Practice Committee discussion on proposed regulatory changes to SLPA scope of responsibility, duties, and functions related to swallow therapy, proposed regulatory changes to SLP aid requirements, and possible statutory changes to SLPA CPD requirements. We ask that the board review the minutes and provide any amendments, if any, before approving it.
I'd like to open up for board discussion at this time. All right, hearing none, I'd like to ask for a motion to approve the meeting minutes and a second.
Dr. White, I'll move to approve the May 15th, 2025 committee's meeting minutes.
Thank you. May I have a second?
Dr. Chambers, I'll second.
All right, thank you. I'd like to check in for public comment at the locations. We do not have any members of the public here for public comment. I'd like to check in with the Sacramento location.
We do not have any members of the public at our location.
And the City of Industry.
We do not have any public members at this location.
Thank you. I'd like to now ask the moderator to open public comment on WebEx at this time.
WebEx is now open for public comment on the motion for the meeting minutes. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment? Seeing no request for public comment, do you wish to continue with the motion?
Yes, please. I'd like to now ask Ms. Burns to conduct the roll call vote.
Ms. Dominguez,
Aye.
Dr. White,
Aye.
Mr. Borges,
Aye.
Dr. Chambers,
Aye.
Mr. David,
Aye.
Dr. Sanders,
Aye.
Ms. Chang.
Aye.
The motion carries. Passes.
Thank you. Move on to agenda item 4, review and possible approval of the May 16th, 2025 board meeting minutes. I'd like to ask Ms. Lorenzo to present this agenda item.
Thank you, Ms. Dominguez. The minute includes the board meeting with updates of board activities, including update and review of proposed legislation affecting the board, update on the Audiology and SLP Interstate Compact, review and approval of revisions to the board's administrative procedure manual, discussion on proposed statutory changes to obtain authority for and implement a retired license status, and review and response to public comments on proposed rulemaking regarding processing time. We ask that the board review the minutes and provide any amendments, if any, before approving it.
All right, thank you. Thank you so much. I'd like to open board discussion at this time.
I had a few typo kind of to amend the report with. The first one is on page 6 of 11. At the bottom of the page, it says, Ms. Dominguez asked if the words most frequently used to announce a vote can be used instead. Ms. Burns replied that it can and noted that changes. I was just going to put noted the change, or probably would be better. And then at the top of page 7 of 11, the first statement mentions Ms. Burns further said that a longer time frame would like 5 years. A longer time frame like 5 years, just years. It's missing an S there.
Okay.
And then on page 8 of 11, towards the lower portion after the hat, it says, it starts with Ms. Dominguez said that licensees should not be allowed to place their licenses. It goes on to say Ms. Dominguez further said, just further said.
Okay.
More.
Yeah. No, thank you.
On page 9 of 11, at the very top, the first paragraph talks about Dr. Chambers, and then right where it says 800, it just says Dr. Chambers recommended to change the requirement so that it is 800 instead of just 100%. I think 800%. And then the last one.
Oh, sorry, can you tell me the location of that one?
In the first paragraph where it says 100.
Okay.
Very top of page 9 of 11, 100. Just 800 or 100, either one. It just says it is 100%. I think just 800.
Okay. Yes.
And then the last one I have is towards the bottom of that same page, 9 of 11. The second paragraph from the bottom says Dr. White asked why there was processing times and regulations. I think just were processing times and regulations. That's all.
All right. Thank you. Are there any other amendments to the minutes?
All right, hearing none. I'd like to check in with the on-site locations. There are no members of the public present here for public comment. I'd like to check in with the Sacramento location.
Motion?
Oh, we have to do a motion first.
Oh, okay, I'm sorry.
Dr. White, I will move to approve as amended the May 16th, 2025 board meeting minutes.
And Dr. Sanders will second.
Thank you. One small minor detail. Thank you. All right. I'd like to check in now with the on-site locations. Here at the Glendora location, there are no members of the public present. Sacramento location?
No members of the public present.
Thank you. And the City of Industry location?
There are no members of the public present.
All right. Thank you. I'd like to ask the moderator to open public comment on WebEx at this time.
WebEx is open for public comment on the May 16th, 2025 meeting minutes and the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few seconds to see if we have a request for public comment. Seeing no request, you wish to continue with the motion?
Yes, please. I'd like to ask Ms. Burns to conduct the roll call vote.
Absolutely. Ms. Dominguez,
Aye.
Dr. White. Aye. Mr. Borges.
Aye.
Dr. Chambers.
Aye.
Mr. David.
Aye.
Dr. Sanders.
Aye.
Ms. Chang.
Aye.
The motion passed.
All right, thank you. Ms. Burns, are we okay to move on to agenda item 5?
Yes, we are.
All right, okay, moving on to agenda item 5, the DCA update and the DCA board and bureau relations update. I'd like to ask Ms. Jones of DCA's solid team to provide the update for us.
Good afternoon. Thank you for the opportunity to share information on where we are with a few things in the department with you. For the governor's reorganization plan, in January, Governor Newsom released his proposed 2025-26 state budget, which included a proposal to split DCA's oversight agency, the Business Consumer Services and Housing Agency, into 2 separate agencies. They would be known as the California Housing and Homelessness Agency and the Business and Consumer Services Agency. After public hearings and review by the Little Hoover Commission and the legislature, I am pleased to share that the governor's reorganization plan was enacted on July 5th. Again, the new Business and Consumer Services Agency will be responsible for consumer affairs, licensing, and enforcement, and the Department of Consumer Affairs would be among the 8 departments in this new agency. The 2 new agencies will officially become operative on July 1st, 2026. DCA is participating in multiple agency work groups on the logistics required to transition to the new agency, and will continue to keep board and bureau leadership apprised throughout the year ahead. Regarding hybrid telework transition, on March 3rd of this year, Governor Newsom issued an executive order requiring all state agencies and departments to update their hybrid telework policies for employees and increase from 2 to 4 days in office per week beginning July 1st. At the end of June, agreements with several labor unions representing employees within the Department of Consumer Affairs were released, delaying the 4-day in-office requirement by 1 year for most of the employees. We appreciate staff's flexibility as the situation evolved. And some travel updates to share. On June 9th of 2025, the Department of Finance issued guidance for out-of-state travel in the upcoming fiscal year. Travel outside of California will be limited to essential travel that is required to conduct state business, and this means requests should only be made for mission-critical needs. DCA distributed a memo to all boards and bureaus on June 16th, detailing the criteria for mission-critical travel, including, but not limited to, enforcement actions, revenue collection, statutory requirements, auditing, and litigation. Additionally, all requests must be provided to DCA's budget office 8 weeks in advance to allow for review by DCA agency and the governor's office. If there are any questions, please contact your assigned budget analyst at DCA. We would also like to remind board members and staff of our collective responsibility to always work to minimize the cost to the state through responsible travel planning and scheduling. To best serve the public, it is incumbent upon all of us to ensure that we are being fiscally prudent in our decisions, especially when traveling for board business. DCA is reminding members and staff to evaluate if a rental car is always necessary versus ride-sharing services. Carpooling is also highly encouraged when renting vehicles. We know that there may be new travel costs board members are experiencing as well, such as baggage charges, so please keep receipts to ensure that you can be reimbursed. If you have any questions, please reach out to member relations so that we may assist you. And lastly, our annual report is one of DCA's biggest projects. Staff work on this report throughout the year, gathering information and statistical data in order to compile a comprehensive report about the department's actions to submit to the legislature. On behalf of the director, we want to thank say thank you to our board staff for your efforts and contributions. Published to the DCA website this summer, the annual report has a wealth of information and memorializes all of the great work done by so many throughout the department. DCA encourages board members to take time to review it and use it as a resource. And with that, I will close and just let you know that if you have any questions or need any assistance, Board and Bureau Relations is here to help, and just let us know.
Thank you very much. This is very helpful information to hear, so I do appreciate that. Thank you, welcome. I'd like to open for public comment. At our Glendora location, we do not have any members of the public with us.
This is Karen from City of Industry. We do not have any members of the public here.
And this is Sharice at the Sacramento location. There are no members of the public here.
All right. Do we have any further board discussion? All right, hearing none. Thank you.
Thank you.
We'll move on to agenda item 6. Do we have time, Sharice?
We want to take public comment online first, though.
Okay. I'd like to ask the moderator to open public comment on WebEx.
WebEx is open for public comment on the DCA update. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. I think I'm trying to move it too quick. I'm sorry, you guys. Apologies. Okay, now we'll move on to agenda item number 6, Board Chair's Report. Are we okay with that, Sharice?
Yep.
We're good on time? Okay, thank you, thank you. We'll start with the, again, the welcoming of our new board member, Francis David, who was initiated, I guess, with attending his first practice committee meeting today as well. For our upcoming meetings, we do have our next in-person meetings for Southern California scheduled for December 4th through 5th of this year. Sharice, Ms. Burns, do we have a location confirmed yet for our Southern California meeting?
We are currently in the works, working with the Cerritos Community College to firm that up. So hopefully that will be where it is, but it is not confirmed yet.
Okay, thank you. Thank you so much. With regard to our board members, we do still have 2 open positions, and therefore we do have openings for the hearing aid dispenser for the hearing aid dispensers practice committee. And there's also a vacancy on the hearing aid dispensing committee also for a hearing aid dispenser as well. So those are the 2 committees that still are not full with their respective members. All right, I'll go ahead and present an update on the speech language pathology practice committee meeting that we had today. We started that meeting at the top of the meeting. Notes. So we discussed the amended regulations regarding scope of responsibility, duties, and functions of speech language pathology assistants related to swallow therapy as stated in Title 16, California Code of Regulations, CCR, Section 1399.170.3. So the committee discussed coursework required. There were parameters established in the discussion. For example, 45 hours of coursework requirement, 100 hours of immediate supervision and direct patient care, written verification of competency, written approval needed to perform procedures. And we also discussed when the office staff will continue to work on the regulation sections with regard to the provision of swallow therapy with bolus materials by speech language pathologists. We also discussed the amended regulations regarding general application requirements and speech language pathology aid and audiology aid requirements and scope of activities, duties, and functions stated in Title 16 CCR sections 1399.151.2, 1399.151.3, 1399.151.4, 1399.154 through 1399.154.12, and 1399.157. So the committee accepted the summary of changes presented by the board staff as they were prepared and proposed, as they prepared proposed text for the rulemaking process. We also discussed the recommendation to the full board to initiate a rulemaking to amend requirements for CPD for SLP assistants as stated in Business and Professions Code BPC 2538.1 and Title 16 CCR sections 1399.170.14 and 1399.170.15. It was already determined by the committee that SLPs should be allowed to satisfy their CPD through the same providers their supervisors are allowed to fulfill their CPD requirement. So now the committee wishes to specifically have independent study programs defined in regulation. The committee also discussed that SLPA should be prohibited from using coursework towards a master's degree that would qualify an applicant for licensure as an SLP pursuant to BPC section 2532.2 towards meeting SLPA CPD requirements. And it will be recommended to the board the legislative proposal to be included as part of the board sunset review as amended. Did I miss anything? Okay. So that concludes the report from the speech.
Did your microphone
Right.
cut off?
Oh, no, somebody, I think the recording came on.
The microphone
Yeah.
cut out. There was a momentary disruption in connection.
Okay. Do I need to repeat any of that?
Please.
Oh, okay. Which,
I think that you were done with the
You were done
speech
with
language pathology practice and then it went quiet.
oh, okay. So I completed the 3 areas then. Okay.
Yeah.
All right. Thank you. Okay. So I'd like to ask Mr. Borges to provide an update on the hearing aid dispensing committee meeting.
Sure, thank you very much. We had 2 items on the agenda. One was clarifying proposed regulatory text for hearing aid dome removal. 2 things that we primarily went over in that was to add identifying where the second bend is in the ear canal as a part of the dome removal certification. Also to specify the bone conduction thresholds to match the FDA red flags. That was 2 things primarily that we covered in that. And then the second discussion was regarding hearing aid dispenser trainee supervision and operations at primary and branch locations. Essentially clarifying that hearing aid trainees will not have branch licenses, clarified their the supervision as being direct and immediate. Also discussed clarifying the word temporary to have a little more precise detail on what specifically that means. And that's in essence what we discussed at the hearing aid dispensing committee. Thank you.
I could go on with the
Thank you.
audiology practice committee if that's all right. For the
Sorry,
audiology,
I was talking. Can you?
okay,
Can't hear you, sorry.
I was on mute. Sorry. I wanted to introduce you. Okay. I would like to now ask Dr. White to provide an update on the audiology practice committee meeting.
thank you.
I was talking on mute.
Getting a little, we're all a little punchy. Okay, so for the audiology practice committee, we just had one item on the agenda, and that was discussion and possible action to amend regulations regarding the audiology aid requirements, primarily centered around defining the level of supervision, discussing indirect versus direct patient care and what that means and what types of activities may or may not be included in those definitions. There was enough change and discussion that the committee decided we're not yet ready to prepare that text to come to the board. So it will be coming back to the audiology practice committee for further discussion at a future meeting. And that's all.
Thank you so much. Off mute now. I'd like to open for board discussion at this time.
I have a couple of questions, clarification concerning what you were talking about with the audiology assistant. One of the things that was being discussed was, as for indirect supervision, was programming a device. I feel like there needs to be a little bit more clarification, because when I'm programming a device, it's with the client sitting there across from me with the hearing aids in their ears, actually making adjustments to the hearing aids. I'm assuming when you say programming a device here, it's in relation to checking the hearing aid in and doing the initial first fit programming without the client being present before they're actually being hit with the device.
I think it was actually more a hearing aids back from repair and just making sure the previous settings are what's in the device. But yeah,
Okay.
similar.
Yeah, same. I would loop that in with that, but
Okay.
yeah, I just feel like there needs to be a little more
Specific language there.
specificity on that.
Okay.
Okay. And then as you're kind of discussing, what's indirect, what can they do, what can't they do, I'm thinking of like, okay, basically what it comes down to in my brain is touching. If you're having physical contact with the patient, that's supervision. If there's no contact with the patient, as you were talking about doing cleaning checks, if the patient's handing them the hearing aid and then they take it back and clean it and then they hand it back to the person, the patient is the one taking the hearing aids out of their ears, putting their hearing aids back in their ears. I don't see anything inappropriate about that. I mean, just about anyone can do that, right? So, I mean, I think kind of defining it more specifically to, in essence, physical contact with the person that would require supervision, direct supervision versus indirect or immediate, however you want to classify each one. But that's just what I was thinking of as you guys were discussing that. So, thank you.
Oh, thank you for that. And the board and staff will be kind of working on that indirect versus direct. So taking that into account, maybe when they come back with proposed language, that'd be great. Thank you, Todd.
Is there any other board discussion? Okay. Hearing none, I'll move on to the on-site locations for public comment. There are no members of the public present with us at the Glendora location.
There's no members of the public with us at the City of Industry location.
There are no members of the public at the Sacramento location.
All right, thank you. And now I'd like to ask the moderator to open public comment on WebEx at this time.
We are open for public comment on agenda item 6. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, please. Thank you. So I'd like to check in with Ms. Burns at the Sacramento location. Do we want to go into recess now and resume board business tomorrow morning? Or do you want to proceed with agenda item 6?
7.
Oh, 7, sorry, 7. I'll get it right.
No worries. We can proceed. I just would have to go quickly. I think I can generally go pretty quickly, although,
If there's
yeah,
question or public comment. It's up
I
to
think
you.
we can do it.
Okay, all right. So we'll continue on to agenda item 7, the
Oh.
executive officers. I'm sorry?
You sure?
I'm sorry?
Well, it starts off with the introduction of the person that will be here tomorrow morning.
Oh, okay,
Is my only thought.
okay,
And it would have been nice to introduce him, and he's here. So,
okay.
I'm
Okay.
okay with
It's gonna
starting
take a while.
tomorrow.
Okay, so we'll go into recess at this time and then resume our board business tomorrow at 9 a.m.
sounds good. Sorry about that.
Okay, no worries. Okay, all right. So at this time, we'll go ahead and go into recess. It is 4:48 p.m. and we will resume our board meeting at 9 a.m. tomorrow, Friday, August 22nd. Thank you.
Thank you. See you tomorrow.
All right, thank you.
You.